Well, good morning, everybody. Welcome to the Nonprofit Healthcare Startup 2024 Summit. It's an absolute honor again to serve as your moderator and have you all here today as we gather to explore the future of healthcare innovation in the nonprofit sector. The summit is a unique opportunity for leaders, visionaries, and change makers to come together, share insights, and collaborate on the groundbreaking ideas that will shape the future of healthcare. Now, whether you are a startup founder, a nonprofit leader, an investor, or a healthcare professional, today is about learning, connecting, and finding new ways to amplify the incredible work being done across this industry. Over the course of most of the day, we're going to be hearing from inspiring speakers, thought leaders, engaging in thought provoking discussions, and do a deep dive into the challenges and opportunities that lie ahead for nonprofit healthcare startups. Our goal is not to just spark new ideas, but to ignite action that will lead to tangible, lasting change. So, as we kick off today's summit, I encourage all of you to engage fully, ask questions, share experiences, and connect with others who share your passion for making a difference. Remember, together we have the power to redefine what's possible in healthcare and create a future where quality care is accessible to all. So, welcome everybody. It is such a pleasure as every time when I work with Glorium Technologies, we put together these great summits that just truly inspire and encourage thought leaders that come to the table to share their ideas to allow you to get to decide what that means to you and how this can help you in this particular segment that you have chosen to be a difference maker and a change maker. One of the things, again, I want to really emphasize that's going to be important while you are involved in today's summit. I'd like you to think about two things. Of course, it can be more than two, but two main things I'd like you to focus on today and come prepared with questions. And when we have our panel discussion, you could also ask a series of questions during that time. Write down what are the challenges or that you're having right now that could be better. I'm not looking for you to focus on the negative of the challenge. Focus on the upside. Focus on how this challenge or challenges that you're having right now, how you could turn those into an opportunity, what you may hear today from one, if not all the speakers, including the panel discussion, and how you can make that better. Number two, I'd like you to think about the result. What is the result that you like to obtain that you don't have now? Because what's going to be great about today is that you're going to be educated by each of the speakers that will be sharing in their area of expertise. Then when they come together to do the panel, we're going to go through a series of questions that for the most part are going to touch on that challenge that you may have that could be better. Those results that you're seeking and don't have. So it's really important that you take advantage of today. This is an opportunity where you have access to people that are very knowledgeable in the areas that they share this content from. So take advantage of it. This is the thing that can take you where you are and where you want to go in your business here in the nonprofit healthcare segment. Now, as everybody is aware, there is a message block here on the right. This is where I will be seeing messages from the audience, and we encourage you at any point send in a question. And when the appropriate time comes up, we will make sure to address that question with the specific speaker that is aimed at that particular speaker to have it addressed. If it's something just in general, we'll make sure to address it as a whole. And of course, during the panel discussion towards the end, we highly encourage you to do the same. So again, the more that you participate with asking questions, the more that you're going to get out of it. But better yet, you're going to encourage and help your peers that are also on here, that they're going to get a lot of value from it because we all learn from each other. So it's not just what's being shared here, it's your questions that make a difference, because now somebody else that might be sitting on the fence is saying, wow, that person addressed a question that I was looking to address, but they did it before I decided to do it. But so you're not only helping yourself, but you're helping them as well. Well, I am so excited, and as always, I don't know, every time I do these summits with Glorium Technologies, I get so much value. Now, I'm not going to be an expert in this particular area. Do I know a lot about nonprofits? Yeah, I got a nonprofit myself. My nonprofit is Empowered Fathers in Action. And while we're not in healthcare in itself, in some capacity we are, because we address the emotional intelligence side of our nonprofit in the area of addressing limiting beliefs. And our sole purpose with Empowered Fathers in Action is to help fathers, become better role models in their families, not just as providers, but as playing an instrumental role in their children's development and how they also treat their spouses as well. And so, what I love about this is that there are a lot of great nonprofits out there that are doing the same. And when it's tied to healthcare, God, there's so many great things that can come about it. And it's going to be your innovation, your ideas, your support that's really going to take this particular segment to the next level. So I am personally excited to hear from the speakers today. I'm excited about the panel. And I'm also going to be very excited from all of you that are listening here with your questions, because I like questions. I know as a professional keynote speaker, I love when the audience comes up with questions because, again, that's where the magic happens. We're up here, myself as the moderator here for today, the speakers that are here, we're here as messengers. We're just here to share information. It's about you, and it's about what you do with that information that counts. So we want to make sure that this information has substance. It can be now applied, and it's simply not going to go one ear and out the other. So again, I can't encourage enough that you use this time frame to your advantage to make this happen. And I am so excited for this summit coming up today. And we will be having also a break or two. Obviously, we're not going to just be going from 9 to 1 o'clock East Coast time today straight. We will have a break or two. That way you could have a bio break, get something to drink, a little snack, whatever that may be. But again, we highly encourage to make sure that, again, make sure you turn off all your notifications. Dedicate all of your focus and energy here today with us. This is where you're going to get a lot out of today's session. And I can tell you right now, from this is your first time here, you're going to get a lot of value. Now, I've been doing this now with Glorium now for, oh God, it might be 3-4 years now we've been doing this. And I can tell you, always the feedback that comes back is just off the charts. And again, it's because of you why we put these summits on. So we're excited today. I hope you are too. And we are going to be getting started here shortly. So everybody get a glass of water, get whatever your favorite beverage is. Just make sure it's not alcohol, okay? You don't want to be doing that too early, right? But just get something that's going, you can get back into that saddle, get ready, because we're going to have a lot of great content coming your way. And so, again, come prepared with those questions, and we will make sure, again, to answer all of them to the best of our ability here today. Well, we're going to be getting started here shortly. And I know we're just about 30 seconds away here from our first speaker. And I'm excited to introduce this speaker, and we're going to be coming up with that here shortly. Okay. And here we are. Welcome, Walter Ulrich. Before I introduce Walter, I want to give him a little background about Walter. Walter today is going to be sharing with you considering and starting a new nonprofit to address global humanitarian issues. Now, he's the president and CEO of Medical Bridges, and I'll give you a little background. He is a leader in global health equity and life-changing and life-saving nonprofit serving the global poor by providing needed medical supplies and equipment to clinics and hospitals. In the last 24 months, Medical Bridges has prepared, staged, and shipped 450 tons of desperately needed medical supplies and equipment valued at more than 20 million to Ukraine, Gaza, Afghanistan, and developing countries in the Americas, Africa, and Asia. Now, Walter was previously CEO of the nonprofit Houston Technology Center. He is a member of the Texas Advisory Committee of the bipartisan U.S. Global Leadership Coalition. He was named Global Leader of Influence by World Affairs Council of Houston and was awarded the Order of Merit by President Zelensky, was honored with the Global Impact Award at the HITTC 2022 G7 Gala, and previously the Texas Black Expo bestowed him their Community Builder Award. He is a graduate and former trustee of Stevens Institute of Technology, and he proudly served his country in the U.S. Marines Corps. And thank you, Walter, for your service, and welcome to the summit. We are looking forward to your presentation today.
Christopher, thank you so much for the warm and generous introduction, and thank you for empowering fathers. That's a wonderful cause. Bravo.
Thank you. And the stage is all yours.
Perfect. Well, I'm enthused to move forward. My view of the world is that the world is on fire, that 4.5 billion people lack adequate health care. And I want to thank all of you who are joining us to be part of this program today, to deal with everything that we've been working on. I'm going to let you help me. I'm going to keep, go ahead. We are at Medical Bridges, hit the entire screen. We at Medical Bridges are totally focused on global healthcare equity, the ability to bridge the healthcare gap by providing to countries around the world everything that they need to provide good, solid medical healthcare.
Thank you.
Special thanks to Glorium Technologies for bringing us all together. They've done this annually. It's a great advance for those that want to start nonprofits. A little bit more about myself. I'm so grateful that Christopher mentioned my previous nonprofit, where we worked with a diverse group of entrepreneurs so that they would be able to deal with creating new jobs, named by Forbes as one of the 10 technology incubators changing the world. We're 6,000 jobs and $3.5 billion of funding. So I do know the good, the bad, and the ugly of startups, and have got 15 years working in the world of nonprofits. So the thing that we need most to talk about is that nonprofits are complicated. Starting a nonprofit is not for the weak of heart. Let's look at some of the global data on the needs worldwide. The economies in the developing world are not going to return to their 2019 economic levels until the end of this year or early next year because of the impact of COVID. And yet the need for healthcare is greater than ever. Meanwhile, we're seeing wars in Ukraine, we're seeing wars in Gaza, we're seeing revolutions in countries like Sudan. This is one of the most difficult times of the world. 5.7 million people in low-income countries are going to die annually from poor quality health care. Every day, 800 women will die in pregnancy and childbirth around the world. That means in the time it takes for us to do this presentation, 16 mommies are going to die doing things that in our country here in the United States, things that we take for granted, that we celebrate. And of those 16, with those 16 moms, 70 to 80 of the babies will die with them. Let's look at the issues around the world of infant mortality. In the United States, to set a standard, Out of every 100,000 live births, about 500 of the babies are going to die. So that's less than one per 100 for sure. In the same time, out of 100,000 live births, only 19 mothers are going to not survive the birth. Now we go across to a country like Afghanistan, where you can measure the infant mortality not out of 100,000, but out of 100 live births. 4 to 5 babies and 1 to 2 mommies will die out of every 100 live births. Haiti, prior to the unrest that's taken place in the last 2 years, statistics were roughly the same. You can see on our slide here the life expectancy. So something we take for granted, that is celebrating the birth of a child, is a very, very risky thing in about half the world. Medical Bridges is in service to humanity, and thanks to Glorium technology and with Christopher's terrific moderation, we're talking about these kinds of issues. In the upper left, there is a Texas Aggie Medical Clinic fully loaded by Medical Bridges, providing for people in South Sudan medical care, often for the first time. Now, in South Sudan, out of every 100 live births, 6 babies and 1 or 2 mommies are dying. This kind of a thing will save lives and keep people alive. Other pictures here show Pakistan. You might recall a third of the country was flooded. The country has not recovered from that. There's Ghana in a couple of the pictures. And then the bottom right-hand picture is in Ecuador. Now, we've talked about Afghanistan, we've talked about Haiti, we've talked about South Sudan and Ghana. These are truly poor countries with enormous gaps in medical care. Ecuador, we don't think of in the same way, and it's not as poor, and yet one 40-foot shipping container with medical surplus, this is medical devices, all of high quality, able to be used in the United States, extra supplies that have been left over, things that would have ended up in landfills, those perfectly usable, are delivered. And the woman in the yellow dress is the mayor of the community, celebrating the fact that they're turning our surplus into health care. And after the speech that she gave and the people in that row, 5 women in native Ecuadorian dress did native dances. Think of that, all of you who are looking to serve humanity. Our surplus has people dancing in the streets in Ecuador. In South Sudan, the men were driving around in pickup trucks. The celebration was bigger than our celebrations for the 4th of July. The needs for all kinds of healthcare services around the world are extraordinary. I mentioned the Texas Aggie Medical Clinics. The students of Texas A&M University every year buy shipping containers and using their engineering skills turn them into absolutely beautiful doctor's offices, as you can see in these pictures here. Send them to us. We equip them with exam tables and the medical care that's needed and ship them to places that don't even have buildings. We never thought we would serve the country of the Bahamas because they're comparatively relatively well off. But after Dorian, 2 of these shipping containers fully equipped with medical supplies were forwarded to the Bahamas to serve people in that country. When you're looking at global healthcare, it's not only the developing world in Africa, Asia, and the Americas, but it also is countries in crisis. Medical Bridges has been and will be returning to Gaza. In Gaza, only 5% of the medical facilities are operational, and over 500 medical facilities have had damage of one kind or another, and the need for recovery once the conflict enables shipments to take place is necessary. Medical Bridges in Ukraine is another example where, as of Today, 1,657 hospitals and clinics have been damaged or destroyed. Think of that, including on July 8th, the largest children's hospital in the country of Ukraine was hit and 95% destroyed. In addition, 25 medical warehouses and over 200 other kinds of healthcare capabilities have been attacked. The needs in countries in war are desperate. Medical Bridges has had the privilege of being able to serve the people of Ukraine. If you're interested in global health, there are three things, or even domestic health, there are three things that you're probably going to need. You're probably going to need volunteers. And in the case of Medical Bridges, our volunteers provide, help us sort the variety of supplies, syringes, needles that we get and package them. If you're like the San Jose Clinic on Fannin Street in Houston, your volunteers are doctors that come in and they give some time to treat the people who need care that otherwise could not afford care through the normal medical systems. You're going to need funding. It takes financial support to run a nonprofit. And many nonprofits, like Medical Bridges, need in-kind donations. Houston has the largest medical center in the world. Technology is rapidly changing, and so high-quality surplus becomes available every day, and those in-kind donations are essential. So, as you think of starting your healthcare nonprofit, think about what are the volunteers you're going to need and the sources of those volunteers. Think about if you need in-kind donations, and you probably will. And certainly think about the funding that you're going to need to be able to go forward. Are you the right person for a nonprofit? What is the mission of the nonprofit? For Medical Bridges, it's bridge the healthcare gap. We don't provide pharmaceuticals. For Blessings International, or MAP, it's to fill the healthcare gap by providing pharmaceuticals. If you're going to start a nonprofit, why do you care? What is it in your heart that makes it move forward? One of the things in my case is my wife is a nurse, and I had a very successful business career, but my wife was saving lives. My mom was a nurse in Europe, in combat in Europe. So having an opportunity at this stage of my life to be able to improve health and save lives really matters to me. Why do others care? Is the mission that's your passion something that other people would share that passion? And are there other alternatives already available? It makes no sense to compete with an existing nonprofit that has the same mission rather than joining up with that nonprofit. So consider whether or not there are other alternatives. Now, many nonprofits are run strictly with the heart, and that's why many nonprofits fail. Nonprofits are businesses, and they must be run with business acumen. So, are you the right person? Are you a skilled administrator? Do you know how to recruit and manage people as you build your nonprofit? And I'll tell you, I'll admit it, I hate asking friends for money. But when you run a nonprofit, people don't just offer to give. Even if they're passionate about what you're doing, they want to help, you need to ask them. You need to close the sale to get them to make donations. Are you comfortable asking your friends for money? Because if you're not, probably starting a nonprofit is not for you. And by the way, I hate doing it, but I'm comforted by the mission of Medical Bridges and do that all the time, regularly and comfortably. In fact, if any of you care about Medical Bridges mission, we're at www.medicalbridges.org. We appreciate your support. The complexities of nonprofits when you talk about globally are significant. You know, you are delivering, even domestically, delivering a humanitarian service is complex. If it's global, you're working with foreign governments, and there are many issues of bureaucracy, many issues associated with corruption, many issues related with their cultures. Something that might be culturally applauded here in our country, in the U.S., or if you're whatever country you're in might be applauded in your country, someplace else might actually be very insulting. My mom used to have a saying, the road to Hades is paved with good intentions. Good intentions can be damaging. Do no harm. The Foreign Corrupt Practices Act will prevent you from doing certain things that would facilitate working around the world. There are plenty of state and federal regulations about nonprofits, except for the smallest and simplest nonprofits. The 990 tax return is a complicated document that requires work every year. Donors and volunteers are interesting. Donors need to be thanked, they need to be cultivated, they need to be encouraged. Volunteers often provide an incremental benefit, but require a great deal of support and assistance. Nonprofit boards rarely have nonprofit executives other than members of the team itself on it. So a nonprofit board is typically made up of people with a big heart for the mission and with the big donors, often people from large corporations who don't actually fully understand what it's like to run a nonprofit. So board management takes time, effort, and energy. Like any business, financial and IT management is important. You know, I can sum these last two slides and introduce the next slide with the song by Mumford & Son. So you will remember a line in it. You need to use your head alongside your heart. Yes, the heart comes first, but you need your head alongside your heart. So let's see where we are. Starting a nonprofit is hard. Raising money is hard. Social media to tell the story is essential. Are you avoiding diluting the mission of others? Is a new nonprofit the best way to contribute? Are you ready to file all the paperwork? And finally, typically a nonprofit is less financially rewarding, more than compensated by the satisfaction of doing good, and lots of good is needed in the world. Will your family support you if you have to travel and be away from home a lot? Will your family support you? A couple of warnings about raising money if you haven't done it before. Most donors have given to the same nonprofits year in and year out. And no matter how good your mission is, breaking in with a new thing for them to give to is very difficult. Think of the last time you added a new nonprofit to your personal giving. For individual donors, they most likely give in December as they look at their year-end tax situation. For corporations, they need to put you in the budget typically around September if they're on a calendar year for a gift that will come the following year. Grant organizations have very specific guidelines to give, and there is no way, no matter how wonderful your mission is, that they will deviate from those guidelines. And most of the grants from grant giving organizations are wired, so it's very, very hard to be the new person in it. And finally, in the United States, an election year is a complication for starting a new nonprofit. So much attention will go over the next 4 months to our political environment. It's harder to get attention for a nonprofit. Some people who are passionate about their candidates are writing big checks, so they're less likely to have checks available for a new nonprofit that they haven't served before. But at the end of these warnings, if you are ready and prepared, if you are passionate, if you believe you have the competencies, if you can surround yourself with friends and family that will support you, as I said earlier, the needs around the world are dire. The needs in our own country for healthcare in so many places are dire. If I haven't scared you away, please go for it. We need your help and your support. Now, quick summary of how Medical Bridges serves. We've shipped 500 tons in the last couple of years, 500 tons of high quality medical equipment supplies to places where gloves are a luxury and things that we take for granted don't exist at all. And this is surplus that might otherwise end up in landfills. For the country of Ukraine, we've sent nearly 80 shipping containers of material and air freighted trauma-related items early in the conflict, $17 million worth of medical materials, 5 40-foot Texas Aggie medical clinics, the first one early in the conflict that today sits in front of a bombed hospital just 30 miles from the Russian border. Medical Bridges delivered $12.6 million in 2023 alone to 15 countries around the world, in Africa, Asia, the Americas, Ukraine, countries in peril. And we aspire to do even more in 2024. The philosophy that we have, and I invite you to share this philosophy with healthcare, rebuilding our country or rebuilding countries in crisis, and serving the world together. I'm Walter Ulrich, Medical Bridges. Thanks so much to Glorium Technologies for bringing us together. Thank you for your attention, and Charles, and thank you so much, Christopher, for the introduction today.
Well, thank you so much, Walter. Job well done, and thank you for sharing just always such valuable information and all the great things that you are doing with Medical Bridges. Thank you so much. So I wanted to ask the audience if there are any questions. I'm just checking the see if we have any questions in the audience here, because we still got a little time here. We got that Walter could address questions. Any questions? Again, alluding to any challenges that you may have that could be better, results you seek and don't have, that relate to what Walter shared from his presentation. What could he address for you today?
Christopher, while you're waiting for
Yeah.
the first question, you know, one of the things that really matters is passion. Why do you do this, and then what do you get out of it? And I failed retirement, and that's how I got.
I remember you sharing that when I first met you. Can you share about that? Because I'm the same way. I'm going to be. I'm 57. I don't think I'm ever going to retire.
Yeah. You know, my wife married me for better or for worse, but not for lunch. And no, I had run the other nonprofit I mentioned in my remarks for 10 years, and I retired, gave him the year's notice, and retired. Was going to do a little consulting on the side, you know. And you do a great job, Christopher, with the work you do, moderating and managing things like these events. And I got a call about Medical Bridges and realized that my business experience, they were run too much by heart and not enough by head. And I realized that they had grown to the point where they needed someone like me, and I couldn't turn it down. I promised them I'd do it for 3, maybe 5 years. I've been there 5.5 years now. And my chairman asked me the other day, how much longer are you willing to do this? And I said 3 to 5 years more.
You go in increments of that 3 to 5. Yeah.
And I'll tell you part of where the passion comes from. I joined this because of the mission.
Yeah.
And as I saw what happened, I became even more driven by the needs around the world to grow and for us to do more. But I think here's a perfect example. I mentioned Haiti at the beginning.
Yes.
Medical Bridges was in Haiti in 2010. I had that one picture toward the end on the right-hand side where people were lined up to get healthcare in Haiti for the first time. In 2010, in Haiti, they had just had that massive earthquake, which has really started the downfall and destruction of the country of Haiti. And a woman had been having a difficult pregnancy, was way along on her pregnancy, and things were going very badly. She knew she was in trouble. And this woman had the courage and strength to walk several miles to get to a church that had been turned into a makeshift clinic. And when this woman arrived, they could tell she was going to die. She was going to die. But the day before, a pallet had arrived from Medical Bridges with a CPAC in it, clearly labeled, pulled out the CPAC, did an emergency C-section, and they saved her and her baby.
It's amazing.
My grandson, Henry, turned 14 on Friday. My grandson is the same age as that baby. That could have been Henry. That could have been my grandson, or Christopher. It could have been one of your kids or your nieces or nephews or any of us. We are all one people, one world. I think of that teenager every day. I will do this as long as I can make a difference and be a good steward.
I love it. And serving others is just, I mean, I always say you got to serve yourself to fill your cup, but then when you serve others from that, you fill it back up again and repeat. It's such a rewarding experience. And I could attest to that, with what we do with Empowered Fathers in Action, helping, men, step up to be more than just provide, just financial providers, but, playing an instrumental role in their children's development and in the family union. So, no, it's so powerful, Walter. Any other things that from what you shared, from that you feel the audience, maybe they're a little shy earlier here in the morning, that you feel could really, help them from the humanitarian level, that what you talked about, because you shared so much great information. If you want to elaborate a little further on that.
The thing about nonprofits, that people who aren't starting one or running one and involved with it, it is so hard to raise money. And so if you're going to do a nonprofit, don't expect that you'll tell the great story and 30 days later the checks will come in or the GoFundMe page will work. I ask everyone to think about their own personal giving. When was the last, how many calls do you get? How many letters do you get? How many ads do you see for the SPCA or St. Jude's on television or something else? And when was the last time you said, yeah, I need to add another nonprofit to my giving, right? So be aware that fundraising takes a lot of energy, takes a lot of planning, takes patience. Fundraising is really about relationship building over an extended period of time, whether it's electronically or person to person, relationship building, and helping them share your passion and ultimately then give. It's not going to happen overnight.
Yeah, absolutely. Absolutely. Well, this is powerful, Walter. I want to thank you so much for taking the time today to share such valuable information. And we're looking forward to hearing from you during the panel discussion here later today. And again, if you have any questions for Walter later, we'll make sure that we'll collect those in the chat box, and you'll have an opportunity to get them answered later as well. So, Walter, thank you so much.
And thank you.
Thank you. And hi, Sean. How you doing?
Good morning. I am doing well. Thanks.
Great. Well, we are excited to have you come on to follow up with Walter here. I know you're going to be talking about integrated healthcare, a community solution. And before we have you start, I just want to give everybody a little background about you. As a social impact entrepreneur, Mrs. Sean Pearson's innovative work has resulted in long-lasting legacy, building community impact. In 2022, she was named the Minority Business Enterprise of the Year by the Hispanic Chamber of Commerce. Women with Vision by the National Association of Women Business Owners, and the Horace Steele Child Advocacy Award. She was also named as one of the top 100 CEOs in Phoenix by Titan 100 in 2022 and 2023. As co-founder and CEO of Xeon Institute, she operates a campus in South Phoenix, Arizona called The Well at Xeon Institute, which offers transformational resources to community, including childcare, preschool, social enterprise development, integrated health services, family preservation services, and emergency resources. Sean is known as a wife, mother of 6, grandmother of 14, transformational speaker, teacher, published author, and a solutionist. And without further ado, Sean, we welcome you to the stage to talk to us about what you'll be sharing on integrated healthcare, a community solution.
Awesome. Christopher, thank you. And Walter, thank you for what you do as well. Hello, everyone. I am excited to be able to share my experiences in the nonprofit, turning our mission into something that can be monetized for solutions. So I'm going to share my screen and bring up the presentation. I have been in nonprofit 30 years now, started in medical assisting and transitioned to fulfill that passion through this work that I'm now doing with Zion. As soon as I figure out how to not be technically challenged, I'm going to share this presentation with you all as well. And I practice this, but while I'm sharing, Zion is a 20 plus year-old organization. I've been doing this work in South Phoenix, Arizona, specifically with the intent of breaking cycles of generational poverty. And so the work that we have done is very intentional around the social determinants of health for the community that we are serving. And so the integrated healthcare was to bring collective solutions. To Walter's point, it's always better to not come in to compete with another agency, but rather be able to complement what already is there so that the community can be greater. And so through Glorium Technologies, I get the opportunity to share the work that Zion has been doing. And this particular work in our community is well overdue. We did what we call a community resource rescue. And for us, a resource within the South Phoenix community, Zion would step in and do the work of either building its capacity so that that resource could continue, or we would begin again with a new work. And so integrated healthcare is something that Zion entered into about 3 years ago when we discovered that one of our long organizations was going to close because a founder who had been here in the community for 30 plus years passed away. So my objective today is to share all the knowledge that I have specifically around social determinants of health, which are impacting how we do the integration work, solutions that are necessary for the community that you may live in, taking a look at some innovative launch approaches because there are some traditional versus non-traditional ways to do those launches, and then having the discussion about collaboration and how important it is to really be able to leverage the resources from others so that you can build capacity faster for your work. As I shared, Zion is an organization that exists to break cycles of generational poverty. We have tons of different programs on the campus that are specific to the needs that have been identified by the residents. And we make those business models replicable and adaptable for other communities wherever there is a lack of resources. And in South Phoenix here in particular, our campus is called The Well. It is the home and headquarters for multiple service providers where we've brought them together to really leverage those resources to really make an impact from the nonprofit perspective on, instead of competing for those dollars that are out there, really leveraging those and bringing them onto the campus so that we have an opportunity to use them together. So as I shared, in the wake of the needs, all of the needs that Walter identified, there's a critical shortage versus in communities like South Phoenix. We are more than 80% minority. We have about 30% of our population that is below the poverty line, and then a great deal of working poor individuals. And access to quality health care is really a need that is understated in not just our community, but multiple. But what we look at in South Phoenix in particular is the social determinants of health. And by that, I mean those things that are impacting the quality of life for individuals. But the World Health Organization defines it as the non-medical factors that influence our health outcomes. What conditions are we born into? Do we grow in? Do we work in, live in, or age in that are impacting our quality of life? Sometimes those forces are larger than what's happening in our local community. It is political systems, it's social policies, and certain things that certainly bring to bear those inequities that we see in other places. And so, in the context of the work that we do for integrated care, we're taking a look at how do we make life better for the residents that we serve, specifically in healthcare, and not just medical healthcare, but mental health care as well. So the model that is created that in Phoenix centers around both mental and physical health. And then we add wraparound services to that because we know that there are so many other factors that impact the quality of life for the residents that we serve. And so if you're preparing to already launched a integrated health clinic or any type of health clinic in your communities from a nonprofit perspective, I would encourage you to speak to the community to find out what their needs are before you begin to implement your solution. Some of the residents have spoken to us about what they call the helicopter in nonprofits that are very well-meaning, but aren't necessarily in relationship with the community that they're serving, or they're bringing solutions that they believe would be a right solution for that community, but the nonprofit hasn't yet done the research to know if the priorities of the nonprofit are aligned with the particular community that you want to serve. And to Walter's point, there may be some cultural factors that come into play that would impact how you deliver your services. So I encourage you to map those solutions with community involvement. Take the time to, if you continue to do what you're doing, don't shift yet, but spend some time to get into relationship with the population that you're trying to serve, to ask all the key questions that would help you identify the solutions that are specific to that target group so that you're not just another generic service provider that's come into the community, but do not necessarily have a relationship with that community to know what the needs are. And so that discovery period would look like identifying those community needs. What are those social determinants of health? Is it transportation? Is it access to culturally responsive service providers? Is it just a lack of knowledge about health and medications that they might take? Take the time to understand who they are through the completion of an asset map. We use a tool called asset-based community development here and at Zion. And so that allows us to look at what a community has, what does the community need? So we've identified the assets and the gaps that are there, and then figure out how we leverage what already exists to build capacity as we're writing grants to be a part of the work that we do. We can have conversations about work that is already happening and how we want. At the same time, we want to take a look at who else is serving in that community. So you don't want to compete with anyone. My belief is that there's too much need for us to be in competition. Some agencies may have a strength that are different than ours. It's a perfect opportunity to collaborate and that's with for-profit or nonprofit partners. If the common area is solutions for the community, I think that common ground is a perfect place to look at how you do cross references or referrals to each other so that the community could be served. And then it's important to count up the cost. What is it going to take to really be an answer for the community that you're in. To Walter's point, it takes money to do mission, absolutely. And so you want to make sure that however you're scaling the business or however you're scaling each of the programs that you launch, that you're doing it in a realistic way based on the budget that you have. You may have to start with those volunteers that may contribute time simply once a week. That's an opportunity to create a weekly clinic for your community, or a weekly outsource that could be provided for the community to make your visibility known there wherever you're starting to serve, until you can actually implement a full plan for service delivery. But it definitely is a work that requires some strategic thinking before you step out, because what you don't want to do is overpromise and underdeliver, especially if you're in a vulnerable community, to be supported when grant dollars are there, but then service providers may disappear after those grants go away. And so that relationship that you establish should be a long-standing one that's built on the integrity of your nonprofit healthcare growing slowly, but being excellent in the process. So that process of actually getting launched takes a number of steps. You want your providers to be licensed individuals, because you're going to need insurances if you're going to be providing medical care, whether it's physical or behavioral health services. Patient identified, what's the facility that you're going to serve in.
Sean, sorry to interrupt. Sorry to interrupt. Your slides weren't moving. I just wanted to let you know.
Okay.
Sorry about that.
No, thank you for. So they're moving on this end. I'm not quite sure. Let's see. Can you all see them still?
I can't see this. I can't see the slide yet. See if you could share the full screen. See if that works.
Let's see. Forgive me, everyone.
Take your time. No rush.
Got the entire screen here. Can you tell me what you see on my screen now?
We just see you right now.
And share is activated on this end, so I'm not sure why it's not sharing.
Yeah.
My apologies. Okay,
yeah.
now.
So when you hit share, it's is it pulling up on your end? See if you could try again. See if it.
I'm going to stop sharing. Now I'm going to go back. Entire screen. Now the share option is completely removed. It's blacked out.
I don't know if there's a glitch. Do you want to?
I have no problem continuing.
Yeah, just continue. I apologize. Yeah, I don't know what.
No worries, and I'm happy to share the presentation with whomever might need it, because it certainly is some quick and helpful hints in terms of your financing for the vision, being able to move you forward in the work. You want to make sure that all of your individuals that are participating have the appropriate licensure. You want to make sure you have your facility. You want to actually explore the opportunity of being contracted with your local insurances, so that you can have the sustainability that is necessary for the mission and vision that you are moving forward. I'm going to, as I continue to speak to you all, I'm pulling my slides up just so that I can see, and I don't want to make sure don't miss anything. I have a saying with the businesses that I work with that is the 4 G's. It's get out, get known, get liked, to get paid. And so as you do this work, even though you're a nonprofit, you want to make sure that you are securing funding across as many platforms as possible. And if you're going to use grants, use those grants as necessarily to feed your organization. I call it the seed versus feed approach to the work that you're doing, because grants are not a sustainable source of revenue. To Walter's point, you have to be willing to ask for money from your network of influence, whatever relationships that you might have. But you also have to be prepared in the philanthropic world when the shift changes or shift happens within the philanthropic circle. They're going to support other things, and healthcare may not be the big thing on their radar. And so if you start a nonprofit with grants, use that only as your seeds, but have a strategy for how you're going to sustain the work. And in the case of Zion, we're a perfect example of how that collaboration has made a difference, because our collaboration consists of nonprofits versus as well as for-profits in multiple sectors: education and business, banking, so many other sectors. And so we're able to bring this collectively in what we call the Zion ecosystem, so that we can serve and sustain. Those for-profit partners have resources that we don't. In the case of our nonprofit, as we got started in the healthcare work, we did not have a line of credit because the work that we were doing never required it. But recognizing that serving a low-income community for us required that we have some capital in advance, because we have multiple state contracts and they take forever to pay. And so you couldn't rely on those dollars that were coming from those contracts to be able to sustain the continue to serve. And so to Walter's point, again, it's a great idea to have some volunteers that are willing to work with you, specifically service providers that can continue to support the community, but aren't necessarily waiting for the compensation to happen before they do the next work. And so the next thing I want to talk in terms of integrated care, there are several different models. Traditional integrated care looks like primary care with behavioral health check-ins that are happening as a part of the care that's provided. In Zion's case, in the community that we serve, because there were we opted to do something a little non-traditional. It went beyond primary care and a little bit of behavioral health with check-ins and interventions, or even primary care with specialty medical care, which is another traditional way that you might see. We chose to actually do primary care with some behavioral health care and then multiple wraparound services. Again, they were based on the needs of the community that we are serving. And so your approach should be the same. What are the needs of the community? And what is the capacity of your organization or your entity to actually meet those needs? And then making sure that you can leverage any existing service providers in that community so that you can make referrals. It can be a warm handoff to that agency where your staff, your volunteers are making the call to connect the people you're serving to that resource. Or it can be a traditional fashion where you just do they go to that partner. We found that it works better when there is a relationship with all of those other entities, where we can pick up the phone, make a phone call to say, we have Jane Doe who is coming to receive whatever service, and then have that patient follow back up with you to make sure to receive the service that they needed. But most importantly, what you want to do as you're creating your service model, don't be afraid to do what is relevant for the community that you're serving. The traditional models will give you a great idea of what a standard practice could look like. But if you're truly going to meet the needs of the community that you're in, you want to make sure that you're assessing what their needs are and modify what you do to meet the needs in that community. And the last thing that I want to share, most importantly, is that collaboration is key. As I referenced earlier, the needs in the community we are in are so great that no one agency, no 2 or 3 agencies, quite frankly, would have the capacity to address everything that the community needs. And none of us can be excellent at everything. So it's important to find those that have a why that aligns with yours. And even if it's not exactly like yours, find the common spaces where you can serve together. And that helps you to expand your, what we call the ecosystem of Zion. It helps you to expand your network and reach into the other sectors of space spaces that the can be impacted just through collaborating with those agencies and build those new relationships, give the access to those additional resources that you know are needed based on the communication with the community, and engage as much as you can in the community that you're serving there, because that's how you can get your volunteers. That's how you will find other networks where you can tell your story and do the ask to get the support that you need. But ultimately, it's all for the purpose of improving the quality of life for the people that you serve. And so when I get an opportunity, I will be able to share the full presentation that has been created for today. But it has some great slides in it that gives a visual of Zion's ecosystem that shows all the different sectors that we touch, but they all feed back into the work that is being done here at Zion specifically for healthcare, not just services that are being offered, but they all play a role in the quality of life for the community that we're serving here in South Phoenix. But it is business, it is education, it is the faith community. It is actually education on all levels, from K to 12 and then higher ed as well. Even our grocery stores and barbershops and other resources like that are involved. And then, of course, other nonprofit partners are engaging with us so that the services can be shared for the different population where there's crossover. And so that is the end of my presentation. I'll make time for questions. It looks like if anyone has questions.
Well, thank you so much. Yes, we got plenty of time for questions. We got until 10 o'clock here East Coast time, so we do have some time. Okay. Thank you, Sean. And I understand sometimes with technical difficulties, things happen. It's happened to me so many times when I've done virtual presentations. But
yeah,
you're an expert in what you do, so I could tell that you didn't really have to refer back to them at all. Sure. So that was great. Sure. So I'm checking to see if there's any questions. Don't see anything right now. But what would be, with what you shared about integrated, healthcare, in a community. I think it's so important that, people, we got to all come together, and create more awareness, around healthcare. What are some other things other than you shared that you could elaborate further on that? I'm just coming up with some questions. And then if anybody, I'm trying to.
Well, Christopher, the other thing I wanted to point out is that I am unable to put my questions in the chat. So I wonder if someone can check just to make sure.
Oh, is that maybe
that we're not having an issue over there? Yeah, because I was attempting to put some questions in the chat for Walter, and I wasn't able. So, but to your question, I think one of the realizations that I have come to in doing the work of nonprofits is that we've been trained through the traditional nonprofit paradigm to always be feeling a need instead of looking at how do we resolve that need. And so our old model of how we do care may perpetuate the problem because we don't figure out how to get the individuals out of the situation. And so a Band-Aid, if you will, versus repair.
Got it.
In this work that we've done with integrated healthcare, part of what Zion is doing is replicating the models after we create a model, teaching the other nonprofits that work in our community how to do exactly what we did so that we can multiply the impact instead of
replicate in this case.
Exactly, because we want to not continue to have such a dependence on nonprofits. Walter shared, the world is on fire. It feels like that, absolutely. But the more we can train residents how to be part of the solution, it's a very empowering impact that they become employees of the nonprofit as well as participants in the programs and processes that we have in place to help transition them out of whatever their crisis is and get them healthy. They become the spokespeople. They become the ambassadors to the work that's being done, and even become the service providers ultimately when they stay with us long enough. So I think that is one of the things that I think is very relevant for the audience.
Wow, that's great. That's great. And like I said, it starts with awareness. And,
yes.
And the awareness is so important because, like you said, you got to you got to make sure everybody's on the same page in terms of what you're doing and how that relates to them. Because ultimately, like you said, they're the ones that are going to be deploying and
Right.
that to the areas that they serve, and
Right.
you want to make sure it's on the same page.
Right.
Yeah.
The 4 Gs are critical, as I said. The get out, get known, get liked, to get paid, or to get the support are essential. Getting out into the community with the message to say who you are and what you're doing. Getting known, but it's important that in getting known that you're actually liked by the community, you're welcomed by the community. So when you take that helicopter approach of you don't serve in that community or you're not engaged in the community enough to know what they need, you could run the risk of not being well received by the very people that you're coming to serve. So being in relationship with them and being liked in the space that you're being called to serve, being welcomed by the people you're being called to serve, made such a difference. So then that expansion of your message happens through the relationships you have and those trusted conversations that residents may have with one another. That is part of your brand. What they say about you when you're not in the room is
Yes.
really your brand, not necessarily what your website says or what your commercial may say, but what do the people that you serve say about you when you're not in the room?
Well, that's so true. And that's the values. Again, I always say those values come through your communication, not only verbally, not just through
Right.
words or written words, but even the tone of your voice, your body language, just the overall
All of it.
energy.
All
And
of it.
so true. And that consistency is so important. That builds
Yes.
that brand. They know that you're reliable, you're a trusted advisor in this particular area. So
Right.
wow, no, such great stuff. Anything else? Because I know I don't know what there might be an issue with the messages because I don't see anything coming in, and there might
Mhm.
be people asking questions, but I can't tell what's being.
Sure.
What else would you say that would be in with what you shared, and if you could relate that further, and how we can create even overcome more challenges in this particular space that could be better. Anything else that maybe you want to expand on with that?
Well, I think
Oh,
that
here's a LinkedIn question. Oh, sorry,
okay.
there is a LinkedIn question. Just came
Okay.
in. That they said, "How does the Xeon Institute address the social determinants in its integrated healthcare approach?"
Well, very specifically for Zion, we based community development approach in that we are using data that other partners have provided. We have local groups that have done the research to determine what the key or the top, at least the top 3 social determinants of health are that are impacting the quality of life for our residents. And then we build those are integrated health clinics. So as an example, we have primary care, we have behavioral health, but we also have peer support specialists. We have a program that is focused on our seniors for healthy eating and active living that focuses on diabetes, heart disease, and hypertension, which are major disease elements that exist in our community. We have a fitness room on the campus so that there's the opportunity to address obesity even in our youth. We have on-site behavior coaching and skill development, but also that happens in the community and at the schools that are around us. We have a partnership with our school district where our child care preschools are actually co-located at the school sites. So parents who might need transportation for child care no longer have that issue. They can drop the child off at child care. They go to school at that site. They go to aftercare at that program. But all of them are connected to our medical providers travel, do services in home as well as at the office and in the community, as do our behavioral health professionals. So
Great.
that's our approach to that work.
And we have one more question, and I know we
Sure.
got to go ready for the next speaker. If you
Okay.
could be quick. What is your vision for the future of integrated healthcare at Zion Institute, and how do you plan to expand your impact?
Well, the vision is that this model will be replicated in other communities that resemble or have the same common factors as does South Phoenix. And so we'll do that through collaboration. There are other states that we're currently working in to do other work. And so the vision is that we'll expand and replicate. And ultimately, we will own the campus that we're on as a nonprofit. So the asset will always exist for other service providers to have a home. So they don't have to worry about the overhead of launching, but they can come right here to the well and be a service provider with us.
Wow. Well, Sean, thank you so much for improvising today as a true professional, and
That's it.
very just always inspiring what you are doing and Walter are doing, and all the great things just keep getting better and better. And we love to hear, again, that your vision's being carried out on the next summit. And thank you again for sharing and being with us here today.
Absolutely. Be here. Thank you for the invitation. I learned so much myself, even as a provider. So thank you for the opportunity to be here and to glean from the others.
Thank you. All right, everybody. We are going to be moving on to our next speaker. Again, if you have any additional questions for Sean, you'll be able to address those later during the panel, as well as for Walter. And we're going to be bringing on our next talk that we're going to be talking about, bringing audio digital biomarkers to market through open collaboration globally. And before we go into well, we still got Sean, and I guess we're waiting for the next speaker. Let's see.
Okay.
Oh, the speaker is not here. Okay.
Okay.
Huh. Okay. So we got more time.
Well, could I take an opportunity to share how folks can find Zion, because we are
Yes,
looking
please
at
do.
work on
For
the
some
national
reason,
level.
I was, you got time now because we don't know what we don't. The speaker isn't here yet.
Okay. Well, thank you for giving me the extra minutes.
Yes.
For anyone that would love to know more about the work that Zion is doing, or even invite us to the space that you're at to share more knowledge, our website is thezioninstitute.org. And so you're able to find us on social media at the Zion Instagram or social media. I would love to travel to wherever you are and bring all of our information, experience, and even support networks. We have partners that are in about 30 states right now through a wonderful local partner called the Open Table that has done a tremendous work. And so we get the opportunity to share in other communities. So again, you can reach us through the website, or even calling the office and asking for me directly at 602-314-6022. So I'm happy to support any work that you all are doing locally or abroad. So it's just I am a personal testimony to what happens when community comes together. So thank you.
All right. Well, great. Well, I guess we still got time, Sean. This is good for you. I don't know with the other speaker. Let's see, Sean. While we have time, would you be able to? Let's see.
Leave the live testimonial
for the event. Yes.
Sure.
Yeah.
Okay. Any key points? I'd love to just personally share being able to be a part of Glorium Technologies Summit on nonprofit integrated healthcare is a phenomenal opportunity to glean a wealth of knowledge that you might need. You don't have to experience the hardships that we did as you're getting launched. And so I would encourage anyone that is interested in nonprofit, interested in integrated healthcare, to be a part of the summit, to glean the knowledge from all of the presenters, and equipped to be excellent in the work that you're doing for your community. So I'm thankful to Glorium Technologies and happy that I could be a presenter this year and any other year that you'd invite me.
All right. Thank you. So I'm going to see. We got some time. Let's see if we have any other questions that have come up. Maybe through this LinkedIn. We're going to see if we got anything else coming through LinkedIn, just because we have a little technical issue here with the messages coming here over the restream here. So we'll wait there. So Sean, I guess we can keep on chatting. We got time.
Okay. Well, one of the things that we've experienced here at Zion in particular, the collaboration outside of nonprofit were most successful because we were able to find businesses and partners in other sectors, specifically for-profit, that believed in the mission. I am a social impact entrepreneur, so I don't just do nonprofit, I do for-profit work as well, but it's an opportunity for my mission as a for-profit consultant to impact the mission of serving a community. And so being able to tell our story through the lens of business and not just through the lens of, can you give me some money, which is the traditional way that nonprofits might present, but really sharing the vision impact that can occur when the businesses engage with us. That has made a huge difference in getting banks to come along, school districts to come along, other smaller businesses that are here in the community to lend their service. And so again, nonprofit is business. It is not it's a tax designation, not a business model. So nonprofit doesn't mean no money. It takes money to do this work. I mean, in fact, if we think about it, the NFL is a nonprofit. And so if you think about the capacity to do the work being really about it being a great idea, that is a fundable idea, that is a sustainable idea, social impact, and presenting it that way in the partnerships. The reason that Zion and the work I'm doing has been able to go to so many states is because of the vision and the strategy, being able to partner with another nonprofit that was founded by a great business mind. And so they see the benefit in taking this show on the road, if you will, and sharing the impact of the work in any community and adapting it to the place that it is needed. And so partnership, again, I can't stress enough. You don't have to do the work alone. We are better together. Leverage every resource that's available through telling your story, and let the other people find where they fit into the story, and do that ask as an invitation to be part of the work. I think that's been key for us in partnerships.
Yeah. And like you said, it is a business, and this is something, it does take money and so on. All right. I'm seeing something came up here. I'm ready
Yeah,
to
I
next.
see a message come through.
Yeah. Okay. A LinkedIn user. So something did come in.
Well, maybe it's one of our
Who is it? We
presenters.
don't know.
Maybe it's one of our presenters.
Yeah. Oh God. So, until we get the cue, I guess, I mean, I love the fact that, you're a big believer in awareness and being that consistent, and it takes a village, so to speak, a community
Absolutely.
to make this work. You can't do it. If I always say, even with my nonprofit, Empower Fathers in Action, how can we possibly reach fathers all around the world just through our entity? It'd be impossible. I mean, even
Right.
with lots of so we have to leverage that with other
Yeah.
similar resources that have those relationships and direct connections.
Yes. And to Walter's point, the passion matters. Your why matters. I would not have been the founder of Zion had I not had others come alongside and support me to do the work. But my own personal testimony is one that is greatly impacted by the social determinants of health, having been able to transition out of poverty myself because others helped along that journey. School teachers, physicians, other people that recognized I had a need and they were willing to fill that need. Then I felt a sense of obligation to come back and show others how to do what was done for me personally, but then to multiply that impact by bringing all of us together and all of us sharing our stories and moving it forward in a way that causes something to offer as well. And I do, Christopher, want to take a moment to tell you thank you for what you're doing for fathers, and
Oh, thank you.
just the impact our families, our children in particular, really need the example of a healthy father. And some of our fathers just haven't been equipped with all of the to be the great people that they are. And so I thank you
Yeah.
for taking the time to reinvest in folks that are already fathers and figuring it out along the way. So Hard Knock University has had to be the helper of so many of our fathers. So
Oh yeah,
thank
that's
you.
how I learned, and but it is true.
Yes.
We're a product of our environment, and
Mhm.
and so we have to sometimes tweak things or learn
Yes.
certain things, and that's some things I had to learn, the
Yes.
hard
Or
way.
relearn.
Yeah,
Yeah.
or relearn, and then
Yes.
But now hopefully we can reverse and not have certain these men have to go. They can learn now and really
Absolutely.
change that dynamic of the family unit.
Absolutely.
Rather than later and learn the hard way. Yeah, so true.
I'd love to see your work replicated. Absolutely.
Yes, we're working on it, working
Yeah.
on it.
Okay.
So that's why I love what you had shared when you were talking about all those things that you're doing, because it is so important, especially in the healthcare space. And
Yes.
So good, both emotionally, mentally, physically, you name it.
Yes.
So
Yes.
needed. So if there's anything else, I don't have anything. Let me see. Let me see if we have another question. I don't see any other question that came in. Well, here we are. We do have our speaker here. Emil is here.
Oh,
All right.
oh, hello.
Sean, thank you so much for
Absolutely.
sharing
Thank you for
and
spending
hanging in
time.
there for the 10 minutes here. So
I'm here, definitely.
appreciate it. All right. Well, we're going to be welcoming now. We're going to be talking about bringing audio digital biomarkers to market through open collaboration globally. We're going to be here with Emil Canzata. He's the founder and president at Verify AI. I'll give you a little bit of background about him. After receiving his BACS in 2012, Emil joined Hewlett Packard in Silicon Valley. In 2016, he joined Pivotal Software as a software engineer. And in 2018, he took leave from work to move to Japan and was appointed Evolution Ambassador and sent to the One Young World Conference to represent Japan. In early 2020, Emil left his job to pursue graduate studies in artificial intelligence at Stanford University. When the pandemic hit, Emil committed himself to pandemic relief efforts and soon founded Verify, a 501c3 organization developing a smartphone app to pre-screen for COVID-19 instantly through AI-powered analysis of voice and cough recordings. Emil is presently also enrolled an MBA and Master's in Engineering student at UCL Berkeley and expected to graduate this year. And without further ado, we welcome Emil to the stage. Emil, how you doing today?
Hey, yeah, can you guys hear me all right?
Yes, we can.
Yeah, sorry, I was like in the wrong link. But one correction, so I'm not at the Berkeley MBA anymore. Currently,
you're
I'm
not?
doing a
Okay.
doctorate in Japan.
Oh, Dr. Japan, thank you for clarifying. I was just
Yeah.
going off of what they
Hmm.
had in the notes there. But
No worries.
yes,
Yeah.
no, thank you so much. And we're looking forward to your presentation here today. We're all here looking forward to talking about audio digital biomarkers and, to market through open collaboration globally.
All right. Thank you. Yeah, let me share my screen here. So, all right. Okay, this should be working. All right. So,
Yep, we can see it.
okay, perfect.
Thank you.
All right. Yeah. So, I'll talk a little bit about this cough biomarkers. So, just to kind of give a recap about the organization. So, we're a nonprofit. I started this about 4.5 years ago during the pandemic. I was a student at Stanford and I had the idea, well, what if we could have a smartphone app to diagnose COVID? So basically, that's when the team grew. I had some professors at the school, and then it really just scaled up. Now we have like 250 volunteers, and we have in several countries like all sorts of people, like I know like lawyers, doctors, AI engineers, folks like that. And also we have 60 partner organizations from basically Harvard, Stanford, Berkeley, basically you name it. Everyone has kind of gathered around this cause, given how impactful it could be. So I'll give you a bit more details about what we're doing. Well, first I'll talk about the problem. So, and I'll tell the solution briefly first, so everyone will get it right away. So we just have this app. You cough in your phone, and it will diagnose if you have COVID, or that's what we've been trying to build, based on sound analysis. Not now. Sorry, the baby came. Okay, so I'll go back. Okay, so now the problem basically that we are trying to solve. So with current diagnostic testing, you don't really know. It takes a long time to get to market. I know during the pandemic we had some acceleration with the whole emergency use authorization, but generally it takes like 2 to 10 years. Like if you're trying to get like a new diagnostic test on the market, because all the stuff with the FDA and also there's manufacturing and distribution costs. So like all the PCR tests were manufactured somewhere and they were sent overseas, for example, and such, right? Okay, so then the also the thing is like getting time to market can take years. But basically, what we're trying to say is that like with a smartphone app like this, people can use it 24/7. You can use it at home. You can get your results in seconds. It's free and also it's anonymous. And basically, you can like kind of have anonymous tracking of where diseases are spreading across the world. Because like for example, with the antigen test, we still don't really know where positive cases are. And you can also just like push software updates. So that was kind of the value proposition of this tool. And also we were aiming to get like a much faster FDA approval because we're more like time to market, sorry, not FDA approval. So the R&D is quicker, trials are quicker, and we can distribute it instantly because the smartphones are omnipresent. Okay, so yeah, I've already shown you the app. So actually this was, we actually got the app to a point where we released it. We had a private beta release with a large medical insurance company in South America, Colombia. So we actually did have 4,500 users who were using this to help protect the health of their nurses who had high exposure as a kind of like a screening tool. But then we hit a barrier. Um, I'm sure like a lot of people would be familiar with FDA because it's a healthcare summit, but so we did talk to FDA and also in Japan, and I also talked to different. There were a few hundred groups actually working on similar technology, and basically we what FDA would be looking for is like multi-disease differentiation. So, for example, if we're having someone cough in the app, we should tell them we should be able to differentiate whether it's a flu or a COVID or RSV. But it actually turns out that's like very difficult to do. So, I mean, because actually the cough sound is actually kind of similar when you have upper respiratory disease infections. Okay, so then the other thing is that the gold standard, they were saying like they kind of want it to be like closer to the gold standard equivalents. So like the PCR testing and other things have gotten very good during the pandemic because like billions, probably trillions of dollars were dumped into developing these tools. So like, for example, if we're going to try to get this technology to 95%, probably very difficult or maybe not even possible. Like just from the sound of a cough, can you get 95% differentiation that they're COVID? So that was a big barrier. And I think a lot of companies face this. I've not seen any company who's gotten FDA approval for this technology. And there are some articles who have looked at this as well. Okay, so then I'm looking, we have to kind of pivot the business. I mean, even as a nonprofit, like the last speaker was saying, we must pivot and have a sustainable revenue model. So I went through this program with U.S. government, and they basically funded my travel. So I went all over the U.S. and also internationally, talking to hundreds of people and the medical AI experts, and seeing like, okay, how can we pivot our technology, this cough diagnostic technology we have, to actually build a product that we can actually get to market and actually benefit people. So yeah, here's some photos with me, and yeah, I was traveling during the winter, so it was quite snowy and. Oh, and also I'll mention I did go to a lot of the university places, so like Boston, Harvard, and places like that. Okay, so then we basically came up with a new pivot. So, and actually, to be honest, we're working on multiple things in parallel, but like this is one of the more public-facing things we're working on. So this had been a problem actually even before COVID, which is we don't really know where diseases are spreading. I know during the pandemic we had all of those like those maps showing like, hey, COVID has 100 cases here, 1,000 cases there, but that all went away because the reason we had all of that was because we were having PCR testing, and that was being reported to the government, any positive cases. So right now, I mean, people generally test themselves at home with antigen test, or they don't test. And even if they're positive, they're not going to basically report that, right? Like, why would they do that? And also there is this thing called wastewater surveillance where they test the wastewater supply, like if there's any COVID bacteria and such, or even other flu and such. But that also is not being used everywhere. There are delays. It takes about a week to detect because people have to basically excrete the virus, and it needs to be detected later. And also, yeah, and then even like building tests. For example, if we're going to test everyone, it's very expensive to build all these, even PCR tests. Even though it's a lot cheaper now, like if you're going to spend like $5 on like 100,000 people per day, that's like very expensive, right? Okay, so. Yeah, so that's why kind of it makes it harder to detect outbreaks of new respiratory diseases, so like future pandemics and such. So this is what we're proposing. So basically, this would be like a kind of, if we have enough people, like, so our system relies on forced coughs, so even asymptomatic. So basically, let's say at the airport, for example, we implemented this new rule that 1 out of 1,000 people would cough in the phone. And we basically, what we do is we analyze all of this data coming in, and we just kind of build an abnormality heat map. We say, hey, normally it looks, normally we're seeing these kind of cough patterns, but suddenly we're seeing a spike of something abnormal. Maybe this could be like a new respiratory disease spread. And that would use our cough diagnostic technology. And basically we would be able to kind of create hotspots. So for in the case of the airport, it would just be maybe like a hotspots in terms of where these passengers are coming from, which countries are the diseases coming from. And then they can put like they can have them tested, for example, like large pre-screening. If we were doing this across a population, for example, I mean, this map is Switzerland, but let's say the government had a policy that, okay, every year when you get your yearly doctor checkup, they ask you to cough on the phone, for example, then we can have this heat map across the entire region. And this would be used by basically public health officials to kind of help have a good gauge of what's the status of the respiratory health of the population and predict any pandemics. Yeah, so maybe pharma companies as well may want to use this for like helping plan where they should sell, I don't know, cough medicine or vaccines, for example. Okay, so yeah, basically we're looking for changes. Okay, so then some differentiators of our org. So we collected a ton of data. I mean, our own data is about 250,000. We did clinical studies. We enrolled PCR positive and negative patients, and we gathered their cough and breathing sounds. And then we pooled it with some open data sets. So we have nearly 500,000 samples. We got our algorithm to 84%. We have the patent with Stanford. And then our nonprofit team, yeah, I mentioned earlier, but we have a pretty robust team. We are looking right now at Japan because I'm kind of partially based there now, and I'm fully fluent in the language. I have very strong government connections. We're looking at bringing the technology there. Same with US, of course. There's a lot of NIH funding and things there. And Singapore is also interesting because I don't know if you're all familiar, but actually the Middle East and Singapore are actually the most proactive, and they have large funding for health tech. So yeah, we have people in these countries actually looking at potential grant funding sources to continue the work. And yeah, I've just gotten back from the Middle East. I'll be going there again probably next month. Yeah, very interesting regions. The air quality is not as good here. One thing to mention though is that this technology is quite useful for Asia because 50% of the world population is actually concentrated in like India, Pakistan, Indonesia, China, of course, right? And the air quality is quite bad here. So we do believe our technology is going to be useful in Asia. Okay, and of course we have some research papers. We are basically a really heavily academic research organization, and my PhD thesis is actually on this company. So yeah, it's quite interesting. Okay, so that's I think maybe I'll take some questions. Right. Okay, done speaking.
Okay. All right. Well, you still had a lot more time, but but yeah, let's see if we have any questions. Excuse me, if they come in. I know we had a little glitch on Restream, so we're going to look and see what comes in from LinkedIn here. And so it's amazing what you've done and what you did during COVID and obviously now as we move on. I mean, with the AI. What do you see? I guess when we're waiting for some questions come in, what are you seeing with AI right now? Like the changes. I mean, it's just rapidly changing, almost like it seems like every week.
Oh yeah, so yeah, we actually are using generative AI as well. So actually, I've been giving a lot of speeches in Japan with my friends from Stanford and Google on generative AI, and for example, we're using it to support our grant writing process. We're using it to support our website development, like a lot of things. Like we're integrating it across the org, the app development as well.
Yep.
So I think what the changes we're gonna see is that companies that took 50 people to run will now be like possible with like 5 people. So what we're going to be able to do as a species is going to increase a lot.
Wow, that's great. Here's a question that came in, Emil, from LinkedIn. Can you recap the challenges and limitations of COVID-19 COVID-19 testing that led to the exploration of alternative solutions like smartphone-based cough testing?
Okay, so let's see. I think basically remember when the COVID was starting? This was just like 4 years ago, and like we couldn't even get the PCR test. So basically, like one is it was not really accessible, and even if it was, a lot of times it was expensive in the very beginning, right? And there weren't enough test kits. This kind of lasted for a couple years. Until the government spent like billions of I mean we put probably $1 trillion of taxpayer money to buy all these test kits for everyone, right? So there was actually a pretty big cost going on behind the scenes. So also like we're just talking about the US, but if you go to developing countries, like they didn't even get it, or they got like the buggy cheap ones, right? So there was actually a problem globally for having the test kits. And the thing is, if you don't know if you're positive or negative, it's quite easy to spread the disease to other people.
Got it. And here's another question, real quick. Is your technology one that could be shared with small clinics as a tool, like remote patient management?
Oh, so like telemedicine. Yeah, I mean, in theory, it is. I mean, it depends on the FDA approval as well. So, I mean, the surveillance thing I mentioned earlier, I forgot to mention, but the reason we're looking at that pivot is because the FDA approval pathway is a little different. Because if you're diagnosing an individual user, it's a lot more stringent than if we're just going to give like a heat map of what's going on, a surveillance testing, right? So small clinics, if they're using this for patient management, that would probably be like the initial FDA approval pathway, which would be quite difficult. But if it's a developing country, it would be a different story. The FDA is only a US thing.
Got it. Got it. And then one more question, because we want you to do a testimonial for us. We're going to give you a minute to do that. But before we do that, I just wanted to ask you another question said, what are the next steps for your company, and how do you envision the future of audio digital biomarkers in healthcare?
Okay, I mean, so we are applying for research funding in several countries in parallel. So the next step will basically be what is it going down the so we let's say we get a I don't know $400,000 research fund. We will use that. We will collect data and fix that use case. For example, COPD is one thing we're looking at. The future of audio digital biomarkers. So to be honest, actually, like I would say 90% of the companies or more who have been working in the space have kind of dropped out. It's because it's so difficult. And especially in the for-profit space, like if you're looking for like 10x, 100x return, which is what VCs want to see when they're investing in a company, when it looks very difficult to get FDA approval, they get wary, right? So I think that audio digital biomarkers will continue to evolve and grow, but it might not be as fast as other spaces where VC money can pour in and really accelerate things.
Okay, great. Well, I know we have a little time. We'd like to see if you'd be okay if you could give us like a minute testimonial about
Hmm.
your experience here with the summit, or if you'd like to share with just a 1 minute testimony about Glorium Technologies, the summit in general.
Oh, okay, yeah. I mean, I
Oh,
really
yeah,
appreciate like.
they're gonna take me off.
Oh, okay. Well, I don't know if it'll take a minute, but yeah, I mean, the whole process has been pretty good. I remember Glorium was doing some like I think IT consulting or such, but I did speak last year as well, and I was really impressed with how the team was quite proactive and professional. With I think there was like different people in the staff for like sending me emails and helping coordinate and creating the. I think there was the video we had before to announce the event and such. So really appreciated how fast everyone was at responding and the professionalism there.
Okay, thank you so much, Emil. Appreciate it. I want to thank you personally for taking time to be here. Just some great stuff that you shared, and all the great things that you've done with what you're doing with AI and your platform. And we're so excited to hear what's taking place in the next steps of your company, and hope to see you on another summit that you'll be able to enlighten us and update us with more information on what you're doing and how it relates to this area.
Okay, thank you.
Thank you so much. Appreciate it. And now we're going to be going to our next speaker. So I'm just going to go down. We're going to be talking about meeting the challenge of successful and equitable leveraging AI to advance global health. We're going to be here with AJ Gupta. And before I introduce AJ, I'm going to give you a little background. He's the co-founder and CEO at ASR.health. He's also chairman of the board of directors of Holy Cross Health, HCH, a multi-hospital social safety net healthcare system, and flagship of Trinity Health, a $20+ billion US-based health system. Chairman of the Open Geospatial Consortium, Health Domain Working Group, co-chair of the group on Earth Observation, Health Community of Practice, Healthcare Infrastructure, Small Group, Commissioner and Commission on Nurse Reimbursement member, United Nations Committee of Experts on Global Geospatial Information, Management, member, College Board of Visitors. He's also attended Wake Forest University. He's the author of top paper at IEEE BHI 2017. That's when it came out. And again, the list goes on. He's had applications for social detriment of health analysis, Webby Awards, and named inventor of the HSR health patents and patent filings. And without further ado, we welcome AJ Gupta to the stage. How you doing, AJ? Is AJ there? Oh, okay. Sorry about that. I thought AJ was coming on. So while we do that, while we wait for AJ, I'm going to do that all over again. Yes, I will record a testimonial here. So yeah, I would love, I just wanted to say this has been, I've been involved with Glorium Technologies now going on for, I believe, 3 years now, hosting as a moderator for the various different events they have in the technology segments that they serve. Also served as a speaker one time as well, in addition to doing moderation. I love what I do. I love to moderate, and I love this platform because it really is highly interactive. We get a lot of great people that come on and ask a lot of great questions. And that's what this is all about. And this is what Glorium Technologies does. They want people to really engage. They want to, make sure that we're addressing your questions, getting your feedback, because this is how we all learn together. And this is a way that they can bring together a platform that they do usually once a quarter, and allowing that to happen. And I am so honored each and every time to be a moderator here, and always look forward to the next one. Okay, that was my testimonial. Okay, so let's see here. Is AJ? AJ is here. So AJ, how you doing?
How are you? Good, thank you, Christopher.
Great.
How are you?
Good. I did give a background about you. And I
Yes,
know
I
you
heard.
mentioned there was an update, but I was only had what I had. But feel free to share about what you do as the co-founder and
Thank you.
CEO at HSR Health. And we're looking forward to hearing about meeting the challenge of successfully and equitable leveraging AI to advance global health.
Thank you. And it's a challenge that we're excited about as well. And I did catch a little bit of your introduction, especially, and a lot about your testimonial as well. And I think that's really honestly why I like to be a part of these events as well. There certainly are challenges to the growth of nonprofits, and there's not a lot of organizations like Glorium Technologies in the world that like to give an opportunity for nonprofits to showcase what we're building. Because in some ways, we do have advantages over for-profit capitalistic mindset firms in building technology. But our challenge is also in scaling tech in a way that is different than theirs, right? And so I'm excited to talk about that, and the work that we're doing in AI, in healthcare, and health equity, in light of the fact that we have some advantages over our competitors, our peers, and we have some substantial disadvantages that we need to learn to mitigate. So if you're ready, I'm certainly ready.
Yes, we are. The stage is yours.
Thanks. Do you have the slides, or do I share the slides? Please share. Okay, where is the share button? Where is the, okay. Of course, I can't share on this browser. Can you share the slides? 'Cause I apparently can't share on this browser.
Please wait. Oh, hold on, AJ. They're going to see what they can do to load it up for you. Hold on.
Thank you.
Yeah. So while we're getting that done, is there anything you'd like to share, like with some of the things you're working on, some of the accomplishments, things that you're doing, anything that you'd like to share with us?
Yeah. So as I started out, we're a health tech firm that grew up in the pandemic. So we had a ringside seat to learn how to predict future health risks. In a pandemic, obviously, the virus, the agent is spreading very fast, and we have to stay a step ahead in a way that you don't have to in normal times, right? You have to stay a step ahead. And so we actually did learn to leverage social demographics data, land use change data, satellite imagery, in order to predict which areas of the world are more likely than others to be hit by a wave of the pandemic. And that also gave us insights into what the downstream economic impacts of that are. And so that's a unique scenario, not just because we're a nonprofit, but also because of the time in which we operate. Being a nonprofit gives us an advantage that we don't necessarily have to, in two ways. One, that we don't necessarily have to make revenue, and we also don't have to make revenue on a quarterly basis, right? Which for-profit firms do. So we can really spend time thinking through a problem, understanding all of the details, and take it to market, if you will, when it's truly ready. That advantage is substantial. So we actually do see in the world today that many nonprofits actually have innovative solutions that rival what comes out of for-profit or large commercial firms. Where we have a different challenge is that we have nothing really to help us scale. A lot of the funding we do get is to do a particular project. So we've been funded, for instance, from a foundation or a government agency to do a project, and that project is completed. The technology is wonderful, and life is good. But to scale that to an industry sector or the globe, that takes margin upon spend. Commercial businesses have that, right? They can project that they're going to make 2%, 5%, 25% margin on the spend, and they can borrow against that margin to enable them to have the cash and therefore the resources to take a solution they've built and scale it, to the world, right? That is something that we don't typically have, right? Typically, we do maybe a cost plus funding, or maybe there's a little bit of overhead funding, but overhead, of course, is costs that we have to spend. We have to find a way to balance that gap. That's specifically our challenge. I think the VC investor and angel market is doing that to an extent, right? There are now some angel investors that will invest in a social good project, and they will accept a different kind of revenue in the background. That's a very nascent, right? And even they are still thinking about what the long-term margin is. And so it's not really truly well suited for us. We do have to solve this problem. And if we can share our slides, I'm happy to go through sort of how we're doing it. But because I do think that this is a problem that can be solved, and I do think that our current focus on equity, on climate change, and sort of social good events overall, everything associated with diversity, equity, inclusion, all amounts to suggesting that maybe the world is ready to go from a capitalist mindset to a more of, you can call it what you want to, but a social good, do good for all kind of mindset. Yeah, I see that they're working on getting the slides up, and we apologize for that because The slides look pretty good. I'll say.
So yeah, so AJ, I guess there's a problem sharing it. I don't know if there's a way to maybe relog into the browser to give permission.
Yep, I can try that. If
Yeah.
all right, I will see you in a second then.
Okay. All right. So we're going to wait for AJ to come back in and see what, maybe there might be just something, a little glitch in uploading the file. But hey, we want to see it so far. What other questions that you may have with the other speakers or just in general? Like, what are some of the feedback so far in terms of the information that you're hearing here? Anything that you'd like to share? Anything that could help? Oh, here we go. Looks like we got something. All right.
Okay.
There we go. All right, AJ, it's all yours.
Thank you. Thank you. So, this is part of our modern world, right? As we get more and more digital and more technical, we're going to find that technical issues are just simply going to be a bigger part of
It's
everyday
part
life.
of the process.
That's right. Yeah. It's one that I'm excited about, right? So, given the challenges with this screen sharing today, I hope I'm going to be able to convey to you that yes, we do run here an advanced geospatial artificial intelligence company developing solutions for the healthcare industry. We call ourselves the Bloomberg of Health. Our name is HSR.health, but we are the
AJ,
Bloomberg.
they said you're coming a little low. Is your volume up? I don't know if I don't know if maybe with the slide they said the volume was a little low, but I can hear you.
Yeah. So I get that. I'm either too loud, like at happy hour, or I'm too soft, like everywhere else. So it's one of those two scenarios.
I can hear you fine, but they said they were coming a little low. But okay, now it's good. We're good.
Thanks. Yeah. The reason we call ourselves a Bloomberg of Health, I sort of hinted at it, is that we got our start a few years before the pandemic working on identifying for the emergency response community what kinds of healthcare needs they should prepare for as they deploy to a disaster site, whether a hurricane or flood or what have you. What we learned from them is that they plan for the health response after they get on site, which is, of course, a couple days after the disaster, and that delay can cost lives. And they planned after fully knowing of the consequences, but because they just simply didn't know what to prepare for. And so we said, well, we can work on that problem. We can maybe predict. And then, of course, a pandemic happens where you really have to be able to predict. So we sort of were in the right place at the right time, but doing that work of predicting health risks, in that case, staying one step ahead of a viral agent, gave us insights into how to predict and what the causative factors of disease spread are, which is why we're a Bloomberg of Health. Our platform can give insights on the disease spread for chronic, social, and infectious disease and how that spread may impact an organization's operations, assets, or the populations they serve. We know that lack of visibility into health risks costs billions of dollars and has expansive consequences. On a personal level, to an extent, we've sort of accepted that. We know that we should do everything we can to maintain our personal health, and yet still something can happen unexpectedly. We can have a heart attack or those kinds of things. And we feel there's nothing that can be done to avoid that. And so maybe we pray or hope that we don't have an unexpected health emergency. But on a societal level, that same kind of pray and hope maybe is not the best approach, as we saw in COVID and as you can see in any kind of large-scale disruption. So our platform enables all kinds of organizations, not just within healthcare, but certainly within healthcare, insurers, pharmaceuticals, health systems, to anticipate what the future health risks are so they can either mitigate or capitalize on those risks. As an example, and this is an example, I think, of a lot of the innovative solutions that nonprofits can do because we have time. We don't have the pressure of returning a profit margin right away. So funded by Natural Resources Canada and the U.S. NOAA, our National Oceanic and Atmospheric Administration. They do our weather, among other things. We were funded to use satellite imagery, develop artificial intelligence algorithms to identify the prevalence and size of plastics in our oceans. And by size, we mean the size of the piece of the plastic, right? Plastic breaks down into smaller and smaller sizes. It eventually becomes micro-sized plastics, which can enter our bloodstreams, right? And that is part of the problem. So we did that. We built solutions leveraging satellite data, leveraging artificial intelligence, and demonstrated for the Fox Basin in the Canadian Arctic, which we're now trying to expand globally, that identifies the marine and land populations that are at risk from that plastic contamination, that can help identify locations for cleanup, as well as supply chains, right? The source of this plastic, as you likely know, is not nature. It is an oil spill. It is marine activity. It is fishery activity that's taking place in the oceans. By knowing those places that are hardest hit, perhaps they can be avoided so that nature can, to an extent, help take care of the problem. But this project was completed. It was completed under funding. And now to scale this to the rest of the world, we need to be able to show that there is a revenue capacity from it. That is the challenge of nonprofits. While more people are understanding or recognize the problem of plastic contamination in our oceans, how it can hurt animal life and coral life and the entire marine ecosystem, there's not a lot of people that would make money through that knowledge. And therefore, it's harder to take this solution globally. Our approach, let's double down on philanthropic giving, while in the hopes that this will allow us to take it global. So to learn more, we're going to do a webinar October 29th, something like this at 12 noon. Please feel free to read our blog or white paper, or watch a demonstration video, or go straight to our campaign site and be part of the solution. As you can see here, shamelessly plugging, as nonprofits can do, for philanthropic contributions, which are, of course, in the United States tax deductible. But let me switch gears and talk a little bit about our platform, because this is, I'd say, the primary advantage that nonprofits have over for-profit firms, right? That we can build, we have the freedom, sort of, to build truly powerful technology. Right. We have a health spatial data infrastructure. That's an industry term for what we've built. Nowadays, people are trying to push the term geospatial knowledge infrastructure. Take your pick. But essentially, it is built on the AWS cloud, running on either the Esri ArcGIS Enterprise environment, which is a licensed proprietary tool, or the GeoServer GeoNode open source stack, which means we can run this without license costs. It is a collection of APIs that we use for curating data from a large number of organizations I'll mention in a second, as well as event-based data pipelines that can launch specific machine learning or AI algorithms that produce a result that can then be connected to a decision support system, either a support system that is essentially a person making a decision based on the input, or in an automated fashion could be connected right to systems that execute the decision. You can find examples of our solution on our open GeoMD platform that's on the open source stack. I mean, and as powerful as I think a platform is that can take diverse data sets and go all the way through to executing an action, we think that our front end to the system is even more powerful. It is, in fact, the world's first health-focused AI orchestrator. We call it ANA because it has analytic capabilities. But what an AI orchestrator is, if you think of ChatGPT plus an analysis engine that can actually do the complex math of AI, putting those things together and managing that entire operation from accepting a user query, understanding the query, clarifying details, capturing the data necessary from within our data lake, executing an algorithm, coming up with an answer that is replied back to the user, or executed directly. That is our orchestrator. I do want to talk about the data that we get a little, because everyone's always interested in data. So we get satellite data from Sentinel-2 as well as many other constellations around the world. This is through partnerships with the satellite agencies, NASA, ESA, as well as AWS, that manages the terrestrial store for a lot of satellite imagery. We've used Sentinel-2 data, for instance, in our ocean plastics project that I mentioned. We've also used it to assess the change in land use and land classification for some of our zoonotic spillover projects, which essentially is checking where in the world an animal disease is most likely to fall into the human population. COVID is a zoonotic spillover disease. Monkeypox, that some of you may have heard about, we're certainly hearing more about lately, is a zoonotic spillover disease. We also use purpose-built LLMs to extract data from reports. You know, we're in the digital age, but we forget that 10, 15 years ago, if you had information, it was probably in a report. It was probably not in an Excel spreadsheet or any database that could be queried. And so to get that older data, we had to build LLMs that literally read and mined those data to transfer the information into an Excel spreadsheet or database or something that can be queried. We did this, for instance, in conjunction with the WHO, who have been maintaining disease outbreak reports for decades. Much of that work is in reports and not queryable. So we built, and now shared with them, LLMs that allow that historic data site to be searched by country and by disease. We also get economic data from the US Bureau of Labor and Statistics and their global peers, social and demographic data from global census bureaus around the world, health data from CMS, CDC, their peers, as well as international and intergovernmental organizations like the WHO and the World Bank. And we can do, although we find in health risk analytics, we don't really need to do tailored analytics, do customer data for tailored analytics, because we focus our work on our risk indices that really talk about a number of areas that I'll try to talk about in the time remaining. Just quickly under the hood, it is a fairly complex data pipeline that goes from conversation to decision support and outright action. We have a fairly complex and sophisticated roadmap for its continued growth over the next few years. I'm going to hope that this demo plays. It is a fairly short demo. Can you see? You probably can't see the demo because it's in the wrong browser. So we'll come back to it if we have time towards the end, but you'll see that it's a conversation between you and Anna that allows you to ask a question, and it gives you an answer that can be seen by data and by geospatial maps. We have started beta pilot testing this, and we are accepting pilot organizations on a case-by-case basis. So some quick work. We're a health risk analytics firm, so we certainly understand the impact of care deserts on health outcomes. A care desert is very much like a food desert or an natural desert. It's an area where there is simply no healthcare facilities available. We've tracked that by service line across the country, and for one of the state of Maryland, we've done with the Maryland Hospital Association a health equity assessment on 3 primary service lines: pediatrics, maternal care, which has become more important across the country in the last few years, and primary care. This was for a number of reasons: to show the impact of lack of health care on the population they served and the economic impact that that has on hospitals, because they have to be the backstop when primary care is not available to populations. And what that allows the hospital and the state to do is understand where hospitals need additional resources to supply additional healthcare services. We've also worked on the influence of social factors on Medicare costs. So as I said, we've been able to understand how not only diseases spread and health risks spread, but what the economic implications of that are. So we were able to take down to a zip code level in the United States the social factors involved in the health rating, if you will, of that zip code, and how much additional cost each year, in this case to Medicare, that implies. Medicare is likely the number one health insurer, the largest health insurer in the country. So this informs Medicare, that insurance agency, essentially, that in this particular zip code, because of these particular factors, they spend $227 per covered beneficiary per year more than another location in the country where these factors are mitigated. That puts an economic cost to social factors, both for awareness, but also informing them what they can do to reduce those costs. These are the specific conditions they should address to reduce those costs. We've also worked on opioids, which is a major problem across the United States. In a similar way, we can identify the underlying causes of opioid abuse and how to potentially mitigate it. In the time left, I do want to talk about how nonprofits can try to scale. One way is to simply grow a for-profit business out of the nonprofit, transfer the intellectual property, create a for-profit entity that now has the rights to that property, and that business now can run as a for-profit. That's one approach. Another approach is to simply take seed investments which bring the investor into the nonprofit in some sort of role. It can be an advisor, it can be as a decision maker. You can be creative with the kinds of roles that people will play or investors will play in a nonprofit. If you just simply Google, you will find that many famous people are a part of many nonprofits to help them build their brand. So they may not make money directly from the nonprofit, but because their brand is enhanced, the revenues they generate from the work that they do perform, they typically are able to charge more for that. A-list actors, celebrities, influencers, all kinds of those individuals do like to support nonprofits. So taking seed investment from that population of individuals is a good way to move forward. And even with the delay, I think I found a way to wrap up on time. I can stop sharing and see if I can potentially share a different window, because I'd love to show the demo if possible. Nope. Sorry. Chris, are you back?
They're bringing me in. There we are. Here I am. Great job, AJ. Just wanted to, as we check and see if we have a couple questions before we go to the break, would you mind if a question comes in, if you could do a 1-minute testimonial for us, just about your experience with? Yeah. So they're going to record right now, and then when you come back, there will be a question. We'll see if we can answer a question from the audience.
Yeah, I see Anton's question now.
Yep. Feel free. They'll take me off screen, and then you can do the.
Anytime. So I kind of led with this, but I believe Glorium Technologies is one of the few, and in fact, to my knowledge, the only company that shines a spotlight on nonprofit efforts to advance global public health, which obviously that's what we do. That's what our purpose of living. And so we really value the relationship, the partnership with Glorium Technologies to have an opportunity really to talk to their global audience about what we do, our challenges, our pitfalls, our successes. And I very much like speaking any opportunity I get to their crowd, to their audience. I always seem to get the higher level and higher quality of interaction with the audience than in your typical conference. So thank you to everybody at Glorium Technologies very much.
All right. Thank you so much. And we have a question. How can generative AI be leveraged to increase accessibility to health risk insights, particularly in underserved areas?
That's a great question. So one of the things that we see as a firm that leverages geospatial technologies is that that technology space is very powerful, but it is still the kind of technology that you need to kind of go to school to learn. it's still complex, and there's not a lot of opportunities to interact with it, right? However, we've also seen that even back from Google's introduction, that people are comfortable with a search interaction. And now with ChatGPT from OpenAI, they're very comfortable with a conversational prompt-based interaction. So generative AI, which is a component of our AI orchestrator, Anna, allows you to just ask a question related to health risk insights and get an answer and get a response. That's very powerful. That's especially powerful for underserved areas where such areas are less likely to have the technical skill to use a data analytic platform, right? So I do think that this is not only going to level the playing field, I think this is going to make the data access platform or interface a thing of the past. Everyone will go to something like a generative AI type chat-based front end to interact with their data sets, their analytics, with their risk insights. I am very excited about the future of risk management overall, health and all risk management with a generative AI conversational prompt-based front end.
Thank you, AJ, for that answer. And I agree. I second that. So it's just constantly evolving, and these tools are only going to enhance the experience as long as we look at them as tools. We don't become dependent on it, but yet it complements all the other things that we're doing, and so true. I'm seeing if there is another last minute question that came in. I don't see anything yet. But if something does come in after, we could always address it during the panel discussion. But I personally wanted to thank you for sharing today and adapting to the tech things that you weren't alone. We had it with almost every speaker. So, but nonetheless, we were able to make do and still give value, and that's what it's all about. I want to thank you for sharing today.
Absolutely. Thank you, Chris.
Thank you. So again, everybody, if you have any questions or any feedback, we'd love to hear from you, what the experience is so far. We're going to be heading just for a brief bio break, a coffee break for about 10 minutes. We're going to come back here around 11:10 East Coast time, 8:10 Pacific Standard Time. So wherever you are, just you could adapt to that time. So again, if you have any questions, feel free to put them in the chat, into the message box, or you can also put it into LinkedIn as well. We prefer here because I can see it, but either way. So let's see here. Oh, wait a minute. There's another question. Yes. Do you want to answer that question? What are the key benefits using LLMs in healthcare applications, and what limitations do they have?
Let me start with the limitations. You have to build your own LLM, right? I paused to let that settle in. So there are plenty of open source LLMs out there. They're powerful. They will get a job done. But if you really want to remove bias in healthcare, this extends to every industry, but in healthcare, if you want to remove bias, you definitely have to build your own LLM slowly, iteratively on subsets of the overall data space that you're collecting. So as we built for the WHO, where we see that there's a lot of reports that are pre-digital, they're not ready for querying over current technologies. We had to transfer that data. We had to use a language model to read those reports, understand the format, understand what the data points were that were of interest and relevance, and then transfer them into your typical database. That has to be done slowly and carefully. It can be an automated process, but it's staged. But once it's performed, now you have a clean data set that can be queried and can be used to train a model. Essentially, we want to start thinking of LLMs as small language models. That term has not become popular yet, but it's a small language model that is repeated over and over again. So rather than learning from terabytes of data where some is unclean, some has gaps that are filled in with made up data, which is really a source of hallucination. It's filled in with made up data so that the structure is sound, right? We use small language models, create your data, you mine a portion of your overall space, learn, then add more, and then add more, and then add more. the result of it will be a much cleaner training and validation data set to use in building the models, and your LLMs will be, more effective for reuse in the future.
Okay, AJ, thank you so much. I appreciate it. This was just great, great feedback in terms of what to the question. And again, we're going to go to break. We're going to come back now here in about 5-6 minutes. We'll come back and we'll have our next speaker. And again, if you have any additional questions for AJ, we'll make sure that those will be addressed during the panel. We'll be right back, everyone. 5 minutes. Okay, everybody, welcome back. Hope everybody had got your glasses filled with some water, coffee, whatever that may be. We got more to come here. We're going to be talking next is mental health inclusive, exploring diversity and hope through nonprofit initiatives for wellness. We're going to be you're going to be hearing from Manami Yamamoto. I'll give you a little background about her. She is the founder and director of Blue Humming Therapy and the Mental Health Environment Change Project, boasts a rich background as a licensed marriage and family therapist and expressive art therapist, earning recognition with a global award in 2021. Specializing in serving diverse clients and communities, she dedicates her focus to providing psychotherapy and psychoeducation to underserved populations facing strong stigma. Through her efforts, Manami strives to dismantle barriers to mental health care, fostering empowerment and support devoid of fear or judgment. Her mission extends globally, advocating for mental health accessibility, particularly in marginalized communities, utilizing platforms like seminars and workshops. She works tirelessly to cultivate supportive environments and ensure quality mental health care for all. And without further ado, we welcome to the stage Manami Yamamoto.
Hi, Christopher. Thank you so much for a wonderful introduction.
Thank you. We are looking forward to your talk, and I'm looking forward. We're hoping we'll have a lot of questions for you to answer on the back end, and the stage is all yours.
Thank you so much. Okay. And all right. Oh, thank you so much. Yeah, my computer is now feeling well today. So thank you so much for your help. Okay. So again, thank you so much. My name is Manami Yamamoto. I am a psychotherapist in California, and I am a founder and the director of the Blue Humming Therapy. So I'm honored to be here so I can share my work in the mental health field and the nonprofit sectors today. So let me go to the next page. Thank you. So I'll focus on these four main points today. And so if you have any questions, I'm happy to answer to you. Okay, let me go to the next page. Next page, please. Thank you. So first, let me introduce our nonprofit mental health organization, Blue Humming Therapy again. So we located in California, and we provide psychotherapy, psychoeducation, mental health consultation, and seminars, workshops to diverse clients and communities. So we especially focus on minorities and underserved communities like race, culture, socioeconomic status, gender, age, and physical and psychological limitation. So our support is not just for individual and families. We also support staff at the nonprofit organizations, teachers at the schools, employees at the companies, and the parents in the communities. So we provide psychoeducation seminar and workshop and group therapy through in-person and online. So our support covers the important mental health topics such as diversity, minority, stress management, boundaries, self-care, well-being, and mindfulness. Next page, please. So these are the picture. We are working with other nonprofit organizations, schools, and communities. So we value working with them because they are essential to support communities' well-being. So as clinicians, we strongly believe in the principle, community supports community mental health. Okay, next slide, please. So to start, let me talk about the current mental health situation a little bit. So according to CDC and the National Alliance on Mental Illness, before the pandemic in 2019, about 19.2% of US adults were receiving some form of mental health treatment, like therapy, counseling, or medication. So of those, 9.5% specifically received counseling or therapy from mental health professionals. And by 2024, this number has risen. About 25% of US adults are receiving mental health treatment over the past years, reflecting an increase in demand of these services. Next slide, please. But the current system still falls short when it comes to meeting the needs of minorities and underserved communities. Let me share the example of the cultural minorities here. So according to data from Substance Abuse and Mental Health Services Administration and the National Institute of Mental Health, back in 2019, only about 9.8% of African American adults, 7.4% of Hispanic, and 6 to 8% of Asian were using mental health services, compared to 18.6% of white adults. By 2024, these numbers have improved a little bit, around 14 to 16% of African American, 12 to 14% of Hispanic, and 10 to 12 of Asian are now accessing services. But white adult rate have also increased to 20 to 25%. So it's highlighting ongoing gaps with POC's mental health accessibility. Next slide, please. So this is another data. Although people of color make up nearly 40% of the US population, less than 10% of therapists are Asian, and even fewer African American, Hispanic, or from other backgrounds. So the gaps are even more for groups like LGBTQ plus community, seniors, and those with a physical or developmental disability. Even though some progress has been made in recent years, these gaps are still significant. Next slide, please. So while cultural stigma and taboo from various backgrounds play a role, the representation is also a significant barrier. So one of the main challenges in mental health professional, we don't always reflect the diversity of the community we serve. It's not just about the language or race. It's about truly understanding the unique experience, values, and the challenges that come with being part of minority groups. So representation is crucial, but we know achieving it in the real world is challenging. So in many cases, it's hard to find professionals who fully reflect the background of the people who are seeking help and also understand how to support their mental health. So next slide, please. So this is why increased number of diversity competent mental health professional is essential. So when direct representation is not possible, we can provide psychoeducation and create the environment that are truly diversity competent. So this goes beyond just meeting people where they are. It means taking the time to understand their backgrounds, their experiences, and what they really need to feel supported. So lastly, developing programs actively promote diversity and equity in mental health care is key to reach underserved communities. By creating inclusive environments and care systems, we can ensure mental health services are not just available, but truly accessible and effective for everyone. Okay, next slide, please. Okay, so I talked about diversity and minorities, but I'm not thinking just talk about those specific minority groups or categories today. So when I say minority, some of you might think, oh, she's talking about the race and the culture because she's Asian. We all have a bias, and then stereotyping others all the time. So it's true, I am minority in the aspect of culture, gender, or living status as the immigrant. But I am a healthy adult, and I was fortunate to receive great education in this country, and I have work now. So in that sense, I'm also majority, and I have a privilege. So what I want to say here is we usually experience both minority and majority. But our minority experience tends to have the most impact, shaping how we see ourselves and how we are treated. These experiences can feel stressful and overwhelming, and sometimes dominate how we engage with the world. So that's why it's so important to create supportive, understanding, and emotional safe space. And let me ask you the question. So, what is a minority experience then? So, we need to know minority is not just a category like race, culture, gender, age, or socioeconomic status. The experience as a minority is the experience of vulnerability. When we experience this vulnerability, we are feeling powerless, like you don't have a voice, or you cannot believe yourself, like you can do anything you wish. And I believe we all experience this vulnerability at some point in our lives. For example, when you get sick or lose a job, when you get older and lose the physical function, when you have psychological challenges or experience unusual life events like a disaster or war, we really feel vulnerable. For some people, this experience of vulnerability can be temporary, but for others, it can be their entire life since they are born to the end of their life. And in those moments, you can imagine how it's so painful, tough, and stressful, and we all need the compassion and the support. So I'm fortunate to have a conversation with many people about the diversity and minority topic. And sometimes people tell me, hey, Manami, we want to support minorities, but we are not sure how to support them. And they even share, they actually kind of fully relate to those minority communities because they've never lived in that minority. And I usually appreciate their honest feedback because it's natural human reaction. People might be emotionally disengaged or disconnected from those minorities because it's so hard for us to relate to the specific minority experience. But I'm often concerned instead of feeling motivated to feel minority experience. Some people get overwhelmed or anxious about being labeled or judged as a racist if they don't fully understand the minority issues. And this fear has been pushing potential supporters away. On the other hand, for the minority communities, they do appreciate the support. But they may feel some disconnection if they sense the supporters are not really feeling them. So minorities just simply want to be heard deeply as human beings. But they often find even that hope is denied. And this can lead to a feeling of more disappointment and even deepen their grief as a minority. So I've seen this kind of emotional disconnection, the separation in many communities, and even more in the society. However, if we know minority experience is the experience of vulnerability, and everyone has a possibility to experience those vulnerability, or if you can remember any of your vulnerable experience, how much you felt powerless and alone, you can feel the minority experience more deeply and have more compassion and emotional connection. And that will huge support for minority communities. So I'm using minority example here because nonprofit are also supporting many minority communities, I mean vulnerable communities. So not just providing the service or program to the communities, but how we are there for them and how we interact with those communities. So this is the key to improve the mental health in communities. Okay, next slide, please. Okay, so now let's talk about the role of networking in nonprofits. So through my work, I understand people and the communities often need more than just the individual care. They need a broader network of allies who can help creating the environment where they feel safe, supported, and empowered. So from my experience working with the minorities and underserved communities, I've really come to see how much the environment impacts their mental health. So it's so much more than just telling someone to work hard on their mental health. We often put that responsibility and the pressure on individual too much, expecting them to manage everything on their own. But I think that approach is missing something very crucial because we are individual people, but at the same time, we are not we are part of a big collectiveness like a group, community, or society. So I've seen mental health is deeply influenced by the world around us. And that's why networking and the collaboration are so important. So individuals are dealing with something bigger than themselves. And that's why the communities need to work together and with even broader societal system to really support the individual who are living in the communities. So through our nonprofits and communities, connection, networks, and collaboration, we can craft a safety net for society. And this is the huge security for our communities. And then this sense of security is something we really need in our society now. So this way, people don't need to feel pressure, they need to manage everything alone, but instead, we have a network of supports, understanding and addressing the bigger challenges that people in the community are actually facing. Okay, next slide, please. Okay, so now let's talk about the wonderful potential technology in the mental health. And this is the fun part. So we all know how much telehealth, like online therapy, has expanded in recent years. Before the pandemic, many therapists were hesitant to do online sessions, including myself. But now it becomes a big part of how we provide the care. So this shift helped us to increase the accessibility of the clients. Like people didn't have access to therapy before because of a transportation issue, work conflict, childcare responsibilities, or physical, psychological limitations. For example, I work with many clients dealing with depression. For them, even getting dressed up and then coming to the office is extremely challenging. So in the past, they missed many therapy sessions because of their depressive condition. Obviously, it's not the client's fault. It's because our healthcare support system was so rigid. Like either you come to the office or you don't get help. So you see this black and white support system here. But with online therapy, they can join a session from their home and we don't need to discourage their willingness to get well. And they feel secure and they don't need to miss their care and they feel proud they could take care of themselves. And another big benefit I really value the help of the technology is, especially when I work with many minorities and underserved communities, technology can give clients more flexibility and control over how they engage with mental health support. So there are so many layers to receive mental health support for some people and their communities because of their stigma, restriction, or fear to mental health, or they don't even aware they actually need a mental health support. For those people, it's so important we can meet the client where they are. So I found a big benefit of using telehealth to peel those layers and invite the client to the care with their pace. So instead of jumping to the therapy at the office, they can take a smaller step to access the care. For example, some clients join a session with their camera off at the first. They keep their video in a small window or change their background every session to make themselves feel more comfortable. So you'll be surprised how our clients can be creative to join the therapy and how they can lead their care. So instead of passively participating in the care of the current healthcare system provide, they can lead their care. And over time, as clients become more comfortable, they start to engage their care system in a more active way. And this kind of flexibility and creativity by using technology nurture the client's autonomy for their care. And it allows clients to feel they are in control of their healing process, and it's so empowering for them. And I think this is the beauty of using the technology in mental health. The last benefit of technology is it allows us to connect with the people beyond our local communities, even across borders. So during the pandemic, I received the requests from people in other countries to give talks about mental health or provide psych education. So technology allows us to share knowledge globally and in creating a new support system and building the community of care that extend beyond geographic boundaries. And this international collaboration is so powerful because mental health is not just a local issue, it's a global issue. And by working together across borders, we can develop more innovative solutions and learn from each other's experiences. And with the technologies, we can reach and support even more people and communities around the world. And then if we can elevate global standards of care, we will not only achieve our goal as a mental health of a nonprofit, but also advance our collective humanity. And I believe leveraging technology in mental health will be a significant asset in achieving world well-being. Okay, next slide, please. Okay, so the final point I want to discuss is the nonprofit mindset and how it shapes our approach to mental health advocacy. So one of the reasons I choose to do my work in the nonprofit sector is I believe in the power of collaboration. So as I shared, mental health challenges are deeply connected to the broader social, economic, and cultural environment. And we cannot change that environment by ourselves. Nonprofit organizations are uniquely positioned to address these broader issues because we share our common goal to improve individual lives and communities. As nonprofit, we all work based on the nonprofit ultimate goal for the people and for the society. And by working together as a nonprofits, not only we can create a safety net for society, but we can also build a powerful force to drive positive change. So through my work, I've seen so many people in the community struggle with feeling alone and isolated. And these are really strong emotions. But in the nonprofit world, we share our common mission and goal. And because of that, we don't fall into the same sense of isolation. We are surrounded by allies all over the world. And even though we are working in different fields, there is a real sense of connection that comes from being part of the nonprofit community. And that feeling of security and belonging is something we really need in mental health today. So we are allies working together and support each other. And through this strong connection, we achieve people's well-being. But I also want to acknowledge nonprofit work is really tough sometimes. It can feel overwhelming and progress can be slow sometimes. So when I'm working with many nonprofit, I see many nonprofit organizations struggle with burnout and a constant stress, especially when they feel like they are not making enough of the change. And I notice many in the nonprofit community often set aside their own well-being to help others. But it's really important to take care of yourself too, because your well-being is equally valuable. So you might feel you need to sacrifice your wellness to help people in the community. But if you are not well, you cannot really support others or communities. And you actually just end up adding your stress to someone who's already dealing with a lot. So without too much pressure to work as a nonprofit, I want to remind everyone here that work we do everyday basis are already really meaningful. Even the change feels small, it is happening. So we are here to support people in the society, and that already makes a world of difference. So we might feel pressure to achieve our mission goal, but let's not overlook the value of what we are doing here and now. And maybe you are not aware, but our presence as a nonprofit is already encouraging for many people and the communities, like what we are just doing now. So before feeling too much pressure to achieve something as a nonprofit, it's important to recognize and appreciate ourselves and our work today. And this self-acknowledgement and a validation can serve as a model for people in the communities who struggle how to find the values in themselves. So to everyone here today, whether you are working in the mental health field, healthcare, nonprofit, or community advocacy, I want to acknowledge your work is incredibly valuable, and I appreciate your day-to-day work and a contribution to society. And then when you feel lost or feel pressure or stress as nonprofit, please remember our talk today. We are already the help. We are already the change, and we all know that. And together, we will all be well. So as a nonprofit, by sharing our compassion and hope, I really believe we can make the world a better place. Okay, thank you so much.
Well, Manami, thank you so much. It was so enlightening what you shared, and we have a question. I think we can get in maybe two questions. We'll see how we do before the next speaker comes up. But we had a question from somebody that asked, how does networking play a role in expanding mental health support and services, especially for underrepresented groups?
Yes, so usually many nonprofit organizations and helping their communities and their groups. So when they know about our work, they kind of like introducing our service and the support to other nonprofit organization or to community, and then that extends the care. So networking is so important for us because other nonprofit organizations know how much we provide in the service for underserved communities. So we kind of introducing each other how other organization is wonderful, and then that kind of connection creating the like a broader care for the community.
Great. And we have one more question if you can answer quickly, and we want to get a testimonial from you as well, a 1-minute testimonial, which we'll do after you answer the question. Another question was, how do you balance sustainability with the goal of providing affordable or free services to those in need?
What's the fourth one?
Yeah, it says, how do you balance sustainability with the goal of providing affordable or free services to those in need?
Yes, that's very challenging question because everybody has a different
Different
situation.
thing there, yeah.
Yes, so it's hard, but we really try to provide a different type of support. So not just the one single support. So sometimes we provide more like a group therapy or psychoeducation to the community as free, or go to some place and gathering together and then share the idea, or using the online. So we have a variety of the support, the approach. So it's hard to give it a one single answer, but we have a different support, and we really try to match with the communities.
Well, I know your fellow speaker here, Sean Pearson, she says, I applaud you for addressing the need for cultural responsiveness for mental health care. Awareness is the first step. She said you had a wonderful presentation. And really quick, if you could answer her question, and we're going to do a testimonial. Are you aware of any shift in the impact of offering telehealth mental health services?
Yes, so telehealth is a big part of the care right now, and I think I assume it's getting bigger in the future because accessibility and flexibility, and also especially for minority underserved communities. So kind of helping them to peel the layers to receive the mental health support. So yeah, creativity and the flexibility wise, I think it's gonna be getting bigger in the future. Yes.
Well, thank you so much, and we would love to have a testimonial about your experience here with today's summit and here with Glorium Technologies. They're going to take me off camera and they're going to put you on for about a minute. If you can give from the heart your testimonial, and thank you for everything you do, and great job today with the presentation.
Thank you so much for having me. Thank you, everyone.
You can go ahead. You could go ahead right now. You could once you come on, you can do a testimonial. 1 minute. They're going to take me off, and then you can do a 1-minute testimonial about your experience.
Yes, I think I have been working as a clinician and then providing mental health support. So I'm not the only clinician. So we have a lot of clinicians in this country and in the international. So I really appreciate your support. And then so if you are interested in the mental health, so please connect with us. And then, so we really like to work with the communities and the people, try to support the mental health. So our connection and then working together, it's so powerful for the society, and we can improve everybody's well-being. So I really appreciate the connection. And if you are interested, so please connect to all healthcare professionals, and we try to improve the global wellness together. So thank you so much.
Thank you. Yeah, can you please specify about the testimonial? If you could do a testimonial just for about 1 minute, they're going to take me off camera. Just going to share about your experience here today, about your personal experience being here on the summit.
Yes, I have been listening to everyone's speech, and like Sean talked about the awareness too, and I think awareness is so important, and then learning a lot from other, the speakers. So I think that this connection and then collaboration is already powerful, and we are sharing that things to the global. So I'm really honored that I have that kind of wonderful experience today, and thank you so much for inviting me as a guest speaker. Thank you.
Thank you. Thank you so much, Mananami. Thank you. Appreciate your time here today.
Thank
We
you.
are greatly appreciative of your services here today.
Thank you so much.
Thank you. And now we're going to move on to our final speaker before we move to the panel. We're going to be talking about how to master the 10 essential ingredients for successful nonprofit food relief operations. We're going to be talking, you're going to be hearing from Paul Rodney Turner. He's the founder of Food Yoga International. I'll give you a little background about Paul. He affectionately is known as the Food Yogi, a renowned speaker, author, and humanitarian whose dynamic presence and wisdom inspire audiences globally. As the International Director of Food Yoga International, formerly known as Food for Life Global, Paul has dedicated over 35 years to feeding millions of children and adults across 60 countries, embodying the spirit of compassionate service and spiritual awareness. His innovative approach to life, integrating ancient Vedic principles with modern wellness practices, has transformed lives through the concept of food yoga, which emphasizes conscious eating, gratitude, and the profound connection between food and spirituality. To date, his nonprofit network has served over 8 billion free meals. That is incredible. And without further ado, we welcome here to the stage Paul Rodney Turner.
How you doing,
Hi,
Christopher?
Paul.
I'm
Doing
good, thank
great.
you.
Oh, very impressive. 8 billion meals. My God.
Yeah,
That
that's over that's 45 years or something like that. The charity's been around
yeah.
since the 70s, and yeah, there's a lot of meals have gone out.
That is fantastic. It's so great to see that. Well, we are looking forward to hearing you today. You're going to be talking with us about, the 10, how to master the 10 essential ingredients for successful nonprofit food relief operations, and the stage is all yours.
Thanks a lot. Now, will you be showing the presentation on the screen here, or should I just
Let me ask. We'll ask and see if they can do that, if that would be possible. Let me see. Would we be able to help Paul with the slides? We'll just wait for a response. They're saying if
share
you
the screen? I can share the screen. Okay,
Yeah,
I can
yeah.
do that.
Yep.
How do I do that?
You should be able. There should be a thing there where in the middle, right in the middle, it's next to the video and the audio, or the.
I see it now.
You can share. Yeah, as long as you have your slides loaded, then it'll allow you to share it, and then you can.
How's that look?
I don't see anything yet. Let's see here. There you go. Yep, we see it now.
And we're gonna do candle. Oh, no, not notes. Close that one. Hang on. I'll have to do it again. 1 second.
Yeah, go ahead. Take your time.
Present. I'll do full screen. And present. You see that now?
Let's see here. Don't see anything yet. No.
Maybe go back to you.
Sometimes there's a little glitch. I don't know if you have to come back in again. I don't know.
I'll do it again. There.
Yeah, I'm not. We're not seeing anything. You might. There you go. Now we see it.
There you go.
There we go.
Yeah. So how to master? So you like the appropriate martial artist here. So the idea is that what I found over the years is that there's 10 essential ingredients that you need, not just for food relief, but particularly for food relief, to build a successful project. So the content I'm going to go through is those 10 ingredients, and they're very practical. They're very logical. And these are the ingredients here, and I'll speak on each one of them. So the first one is united vision. Second is 5 essential strategies. The third is excellence. Fourth is involve people. 5 is promote. 6 is endorsement. 7, social integration. 8, truthfulness. 9, patience and friend raising. And 10 is purity. So these are the 10, very different to what you'd probably expect when you talk about 10 ingredients, but these are the more of the philosophy of developing a successful food relief charity. So united vision, the most important thing here is that we want to have the team committed and centered around a united vision, everyone working on the same page essentially. ensure that everyone's got, emotional investment in the project, and they're agreeing on, the core values of the project. So you want to create a mission statement which guides all those activities, and regularly review that mission statement to make sure that it aligns with the mission, the values of the charity as it evolves, because things change. The 5 essential strategies are: identify and target the social needs. So you want to look at what's happening in your local community. Is unemployment an issue? Is it children? Is it elderly people? I know when I was in Russia traveling back in the day, in the early 90s, the fall of the Soviet, one of the biggest problems in that particular country was elderly people were not getting cared for, because there was no social security system. So pretty much the elderly people were sort of left on their own. And it was very sad to see grandmothers and grandfathers on the street begging just for basic needs, and they weren't being taken care of by the family. So identify the social need in your particular community, target that obviously with an innovative solution. Partner with other organizations who have established themselves in the area, so you can lean on them to build your brand, to build your reputation, and also to get a sort of a foot in the door and establishing your presence. Focus on feeding children, because children are the future. So wherever you are, you may have a particular social need that is standing out, whether it's refugees or elderly or homeless people. But in any case, you should always make sure there's some sort of a project, some sort of an outreach to feeding children, because they're the future. Plant-based, of course, that's important to us at Food Yoga International. We believe it's not only more cost efficient, but it's better for the environment. So a plant-based solution is always, checks all the boxes. And begin by feeding your own community and family. So charity begins at home. So you want to make sure that you're building a strong foundation, and that begins with establishing something on a local level before you start to expand beyond your local area. Excellence in service, nothing more important than quality. Quality is more important than quantity. So strive for excellence in everything. So make sure that, even if you're only serving 20 meals a day, if they're the 20 best meals that you can serve, then that's better than serving 100 poorly prepared meals. Train your volunteers in food handling, proper food handling techniques and services. Make sure they understand the basics of proper handling, quality-wise, and ensure that all food is prepared and served with loving intention. That's actually something which is very unique at Food Yoga International. We believe that food has an inherent value on a subtle level. So one of the ingredients of the food that we prepare is the intention that we invest in that food as we prepare it and serve it. And that's often overlooked. But we all know this for a fact. We all have the experience of tasting our mother's meal or our father's meal that's prepared with a loving intention. We see the difference. A meal that is prepared at home has a much more deeper impact on our consciousness and our feelings. So we believe that food is a carrier of intention at Food Yoga International, and that's therefore one of the most important aspects of which makes us different in this space. Involve people. Everyone loves to serve. Service is the innate characteristic of the soul. We all thrive on service. We may have all the money in the world, but if we don't have a purpose, a service, then we're never going to reach that satisfaction. So that's the fact. That's a fact of life for every single person in the world. So we want to look for ways to engage people in serving in the project. Everyone has something valuable to offer. Every single living thing on the planet has a service to perform for the entire ecosystem. So encourage broad community participation in the project. Start a supporters club, create a role for everyone from cooking to administration. There's always something that someone can do. Promote. There's a lot of noise out there, and in order to stand out, you've really got to promote, because now with the advent of social media, it's so difficult to get noticed. So you've got to do whatever you can to stand out, whether that's leveraging on influential people, or whether that's doing something out of the box and creative and standing out and creating a video, for example, that goes viral. So the duck that quacks the loudest gets the bread. So the key points here are propagation is crucial for building awareness and support. Use every available platform possible. So you want to have presence on all the different mediums. Brand your program with logos and consistent messaging. Consistent messaging is super important. So that way you can, define yourself, uniqueness. Utilize noteworthy days. This is another interesting way to propagate or promote. You want to make sure that you're taking advantage of established community events. For example, I give here is Veterans Day. On Veterans Day, it would be ideal if your project was providing meals to veterans or homeless vets on the street. So you're highlighting something which is established, and you're making yourself relevant in that respect, or your project relevant. Endorsements, leverage the biggest voices in the room. Key points here are leveraging endorsements from celebrities, dignitaries, influencers, and so on. Endorsements build credibility, and they expand your reach. Seek out endorsements and testimonials from respectable figures. So it's very important also to make sure that you choose the right people to endorse your project. Don't align yourself with people that maybe have a reputation that is adverse or not representative of the morals, the standards, the values that you represent in your charity. So make sure you're choosing the right people, and highlight these endorsements in all your promotional materials. Social integration. This is an important one. Always try to be relevant. It's similar to the earlier point. You want to integrate your program into the community through events and celebrations. Use festivals, holidays, and things like that to leverage that so that you become more and more relevant in the eyes of the public. The example I'm giving here in that picture is Holi. That's a festival of color, which is very popular in India. It's become popular in many parts of the world. But the basic idea behind the Holi festival is to promote unity and diversity, that we're all very, very different, but we're all connected on this planet as earthlings, as brothers and sisters, energetically connected. So that's a very beautiful example. So you want to look for those sort of opportunities where you can make your project even more relevant in the eyes of the public. Truthfulness is super important. It's literally the last leg of religion, according to the ancient Indian Hindu teachings. It's the last leg of religion. Transparency builds trust, and maintain honesty and transparency in all your operations. Demonstrate accountability with an open book policy. Adhere to ethical fundraising and financial practices, and regularly report to donors. Make sure the donors are aware that the money that they're donating is going to specific things which they expect to happen. Make sure that your money is not being used, being used efficiently, and it's not being used irresponsibly. Another example there, I say utilize blockchain technology. It's a beautiful thing about blockchain is that it's immutable records, so that therefore there's no such thing as tampering the records with the blockchain. Patience and fundraising is the next one, and it all starts with a handshake, because if fundraising really is all about fundraising, if you want to build a consistent donor base and expand your donor base, focus on building friendships before fundraising. So establishing that relationship, that care, that concern, opening yourself up, being very honest and down to earth, and saying, like, this is what we can do, this is what we can't do. We appreciate any support that you can offer, but being very honest and down to earth and friendly. Friend raising is the most important aspect of fundraising. So cultivate relationships, build trust, engage donors through newsletters and personal communications. And another important point here, takeaway, is that 80% of your income will come from 20% of your donors. So make sure you invest that proper time to cultivate those people. Purity is the force. May the force be with you. That's something which I learned when I was a monk a long time ago, when I was practicing a Hindu tradition of monkism. And one of the things we learned was that purity was the force. It's the most powerful force in the universe. If you're pure, then you can cut through all the barriers of rejection. So emphasize purity in all aspects of your program, food, intention, and service. Ensure all the food is served as is plant-based, because plant-based is not only is it clean from a nutritional point of view, more nourishment for the physical body, but it's also cleaner for the mind and consciousness, because there's less negative influence on that food. Less pain and suffering is invested in that food. Educate your team on the spiritual and environmental benefits of plant-based diet. Implement practices to maintain purity in food preparation. And a quote here: purity, humility, and love are the most powerful forces in the universe. The last one is sustainable. That's the last of the 10 ingredients. So these are other aspects of developing an impactful project, is sustainable food relief. Because nowadays, with all the talk about global warming and climate change and things like that, people are starting to be aware more and more how important it is to respect Mother Nature, and how important it is to prepare and preserve the future for the children coming through. Make sure that we're not destroying things in the wake of their evolving into the becoming leaders of the world. Sustainability is crucial for long-term impact. Incorporate environmentally friendly practices into your program. Use local, organic, and plant-based ingredients to reduce environmental impact. Implement practices like composting and recycling. And the environmental benefits of a plant-based diet are just well-established facts these days. Integrating ethics and compassion. Service with a smile. Ethical values and compassion should guide all operations. Serve with a heart full of love and commitment to do good. So you want to make sure that the people that you're involving in this project have the right sort of motivation. They're not doing it simply for fame or name. They're doing it because they actually care about the people they're serving. So make sure you choose the right people and you train them up so that they have a heart filled with compassion and concern, and they're actually doing it for the right reasons. Emphasize the role of compassion in volunteer training, and make ethical decisions making a core part of your program. True strength lies in compassion. And building a better tomorrow. Life is about service. And this is a point I touched on earlier on, that the innate characteristic of the soul is service. Whereas the innate characteristic of, for example, sugar is sweetness, water is liquidity, fire is heat and light, there is an innate quality of the soul that really motivates us, and that is service. When we serve is when we actually feel satisfaction. When we're gifting a present is more satisfying than actually receiving a present. So it's sort of built into our DNA. We're programmed to serve. We want to serve. We like to serve. It actually fulfills us. So the key points here, we've covered essential elements, practical strategies, and the importance of sustainability and ethics and compassion. And by applying these principles, your program can make a lasting impact. And the actions that get involved spread the word and help build a better future through food relief. Service is the innate quality of the soul, as I mentioned, and that's a very important takeaway. If you want to do something valuable, do something of service. And that's the last slide, and I think I have contact information there, which something, if you can reach us at ffl.org. We're Food Yoga International. As Christopher mentioned, we're the largest plant-based food relief in the world, and we're actually serving over 1 million meals every day, and they're all freshly cooked plant-based meals. Thank you.
Okay, thank you, Paul Rodney. Appreciate it. Great presentation. And I know we also have a couple questions here. We had a question from somebody in the audience listening. What are some practical strategies for effective food distribution in nonprofit settings, especially when resources are limited?
A practical solution. I mean, the point is, with food relief, we often think of it has to be a complete meal, like a full meal, and in order for it to be effective. But actually, even the simplest offering of food can be very effective, because at the end of the day, as I mentioned, food is a carrier of intention. It is a great communication tool. So when you're offering something, even the simplest thing, it can be such a meaningful impact, make a meaningful impact on that person, even if it's an apple, a banana, a couple of bananas, a bag of peanuts. It's like, thank you so much for caring. I feel the love in this offering. I appreciate you. It's like, so we can start very small. It's all about the
Yeah.
intention and
Intentions.
the quality of, the giving. That's the most important thing.
Love it. Love it. And the attention is so important. Another question is, what is your vision for the future of nonprofit food relief, and how do you see it evolving in the coming years?
I think more and more projects are going to start to resonate with the plant-based solution because it is much more sustainable, as research is showing. It's way more cost efficient. It's better for the planet. It's better for animals, and it also conveys this idea that we're all in this together. We're all equal participants in this thing we call life. Every single living thing in the world has a service to perform for the entire ecosystem. Every bug, every insect, every herb has something to provide to serve the entire ecosystem. So when we value that, then we learn that a plant-based solution is the best solution for food relief because it is the solution which has which creates the least amount of harm and provides the greatest amount of good.
Great. All right. So good. I mean, this is some great information, and I love what you're doing and how this continues to evolve. You know, before we're gonna ask if you could do a testimonial for us, but before we do so, I just wanted to just maybe ask one more question. I know you answered the last question. What's the future of non-profit? But I just wanted to say from your organization, what is the next big thing that that you feel like is going to be something you're going to make a big, even for a bigger difference than you have so far in this particular area?
Well, for the longest time, we were branded as Food for Life Global. That's how I initially established the organization. We recently rebranded as Food Yoga International, and there's a couple of reasons for that. One is that we wanted to emphasize the food philosophy of the charity. So we're not just simply filling bellies. What's more important to us at Food Yoga International is that we're trying to shift consciousness using
Yeah.
food as the medium. We want to prepare meals on it with a loving intention, pure, clean, plant-based meals, and use that as a way to communicate, I love you, I care about you, you're important to us. Here's a meal that's prepared with love. It's not only going to nourish your body, but it's going to nourish your mind and soul. And so we want to emphasize that aspect of food relief because at the end of the day, there's no lack of food in the world. Hunger is not because of lack of food. Hunger is because of a lack of unity. We don't see ourselves as a united global family. And because of that, the resources are not being properly shared. And therefore, there are people that are starving. If
Yeah.
we actually saw ourselves as a global family, things like hunger would disappear overnight. So at Food Yoga International, we have a practical solution for creating this sense of unity. That's why our mission is uniting the world with pure food. And so we want to emphasize that by rebranding, the charity as Food Yoga International. And our goal is to create more food yogis. So yeah, I'm a food yogi, and I want to see more food yogis.
I love it. I love it. I love the term. I'm into yoga. I do yoga, but now when I think about
There
it
you
with food,
go.
very very impressive. And we need more food yogi advocates out there.
Exactly.
Well, this has been a wonderful presentation, Paul Rodney. I can't thank you enough. Would you mind giving us when they're gonna take me off camera,
Sure.
off the video, excuse me. And then for 1 minute, if you could give a testimonial about your experience with the summit or your experience overall with the summits with Glorium Technologies.
Yeah, sure. Okay. Hi, my name is Paul Rodney Turner, and I just wanted to say what a pleasure it was to participate in this summit. At Food Yoga International, our goal is to unite the world with pure food. And the more we can share this idea, the more we can, get ideas from other nonprofits and become better and better, the better the world will be. So I appreciate this opportunity to share what we're doing at Food Yoga International and hear from other participants. And I look forward to a brighter, happier world where people are united and happy, and there's less violence, and the world is more nourished physically, mentally, and spiritually.
Okay, thank you so much. Wonderful testimonial, Paul Rodney. Thank you so much for taking the time to be with us here today, sharing your wisdom and all the great things that your organization is doing.
Thank you so much. I appreciate it.
Thank you. Well, everybody, we've come to that time now. As we near the end, we're going to be going into our panel discussion, and we got about 5 minutes before we could start, so we'll have some more time for the panel. I know we have someone that's going to be slightly late, but we'll have at least some panel members that will be available. I got to see if they are available right now, because originally we were supposed to go at 12:15 East Coast time, but we're going to check and see if they are free. And we're going to be talking about scaling nonprofit healthcare startups. What are some of the best practices, pitfalls? So this is going to be really important. So if you are in a nonprofit right now in the startup phase, I mean, you got tremendous value from our speakers and subject matter experts today. But now we're going to come together as a group, a panel, to address a lot of these questions that you may have. And we see that we got two. I got 2 out of the 4 that are ready. And I guess we could start. If we could always add people as we go, and we can go from there. And we got a lot of great questions we're going to ask the panel. So let's see if we get that put into effect. Here we go. Here's Walter. Here's AJ. Wonderful. Great. And then we will we'll add Emil and Sean as they come. That maybe they had to do something, but we'll add them as they come. So just to give a little bit of housekeeping items about what we're going to be doing here with the panel. We're going to again. We've already introduced the topics. You already know the panelists here. I'm going to have each of them just give them a brief background about their experience around this topic about scaling nonprofits. We're going to make sure that each panelist is going to have a chance to address the question. They'll have about 2 minutes or less to address it, and then we could all then together just finalize and give some tremendous value to the audience on that question. So let's go ahead and start here with we got Paul Rodney. Great. So this is wonderful. So we're going to go from top to bottom. So Walter, if you could just to give a brief, again, background about yourself, and again your experience when it comes to scaling nonprofit healthcare startups, best practices and pitfalls.
Terrific, Christopher. It's great to be back after the morning session. I also thought Paul made some really strong points about sustainability, which is an issue for any humanitarian nonprofit. How do you not only deliver a service that has true value, but how do you sustain it? In terms about scalability, I think the secret is scaling up a nonprofit is no different than scaling up a for-profit business. It's a simple matter of, are there enough sponsors, donors, and partners willing to be able to provide the things that are necessary to grow? Medical Bridges has had this ability to grow successfully, but one step at a time. It's very important not to try to grow too fast, because then you risk the survival of the organization. But at the same time, if you're only standing still, you're not serving as much of the market as you can serve. Medical Bridges has roughly doubled over the last 5 years, doing one step at a time.
I love that. It's a process. And yeah, like you said, you don't want to grow too quick, and then now you can't really accommodate, and that's always a really difficult spot to be in. AJ, from your perspective, if you could just briefly mention a little background again, and your background in the scaling nonprofit startups, and then we'll get in after we go through you, and then Paul Rodney will then get into our first question.
Thanks, Chris. Yeah, this is Ajay Gupta, HSR.Health. Obviously, nonprofit will focus on developing and modeling health risks to share with the world, all kinds of health risks. So that's one challenge that we face. When we look at health risks, we're not just looking at disease or chronic illnesses or climate related, but we're looking at really anything that impacts health posture. And I will say that the challenge that we face in scaling, I think Walter's right that everybody faces, for-profit and nonprofit, all face challenges. Ours is a little different in that, as I said in my talk, that we don't have a margin to play with, right? So when we sell a product or service, we don't sell it for slightly larger, more than that costs us to make it. That's not really our mindset. That margin, when that margin scales, you can borrow against it, right? So if you make 10% margin on a product that will sell to 3 billion people, that's $30 billion in potential asset that you can share with bankers and investors. Obviously, they're not going to agree with your number, but they will let you borrow against those future revenues. So you can take the money you need to get to that level. We simply don't have that. We do have to find different strategies to get our products and solutions in the hands of people. One difference I see now is that now people are accepting that nonprofits have a profit, not motive, but that they do things that elicit a profit on somebody's behalf, and therefore it's helpful, but that's the challenge. That's the bridge we have to cross.
Okay, wonderful. Thank you, AJ, for sharing. And Paul Rodney, if you could share just briefly again, just a quick background, and then how it applies to scaling nonprofit startups.
Paul Rodney Turner, so director and founder of Food Yoga International, the largest plant-based food relief in the world. So in terms of scaling, one of the suggestions I give when someone approaches me saying, hey, I want to start a project here, what do you suggest I do? I don't have much money, but I really want to do it. The most effective way to start, or even to expand, is to collaborate, to partner, to leverage established projects, leverage their network and work with them, offer some value to them. For example, this is obviously very small scale. So for example, there's a food kitchen in the town that you're working at, you're living, and you want to start a plant-based food relief. So it's that food kitchen's not plant-based, but you could approach them and say, hey, we have a plant-based solution. We would like to collaborate with you and offer that plant-based solution to your clients. Maybe every Tuesday or Wednesday night, we can take over the kitchen and we can provide a plant-based solution. So there's one practical way that you could get started and expand your reach by leveraging the resources of an established brand. And by doing that, you would also build your reputation, because now you're working with an established brand. So I'm all about collaboration and partnerships, and I think that's one of the most effective ways to scale your project.
I think I support that 100%. In the for-profit side, I call it joint alliance partners. So yeah, it is so important.
Same concept.
Absolutely. Such great wisdom from all three of you. So we're going to get into the first question. And again, we're going to limit each person about 2 minutes just for the sake of time. And then we'll discuss it as a whole for a few minutes after that. So the first question, and we're going to start with Walter, go from top down again. What are the foundational principles for starting a nonprofit in the healthcare sector?
Well, first, I'm going to compliment and piggyback on what Paul said. Medical Bridges is in 104 countries delivering high quality medical surplus and equipment. And we do it exclusively through collaborating with partners on the ground in each country. We can't possibly understand the cultural rules and regulations in every country. So that collaboration is, I think, a key for anything. And with regard to this specific question at hand, I think the essential element is, again, as I mentioned earlier this morning, from the song by Mumford & Sons, use your head alongside your heart. Many nonprofits failed when COVID happened because they weren't run like a business. They were strictly run from the heart. And when an issue happened that required business expertise to solve the problem, they just didn't know how to deal with it. A nonprofit is a business, period.
Yeah, it is a combination. Like you said, you have to have heart, but you got to also, it's a business, and you got real life issues and situations that have to be addressed in a pragmatic way. So true, Walter. AJ, from your point of view for 2 minutes, what would be your input to that question? If you like, I could repeat it again. What are the foundation and principles for starting a nonprofit in the healthcare sector?
Thanks. I mean, it's a very good question. And I guess I'm a little bit thrown. I mean, I know Walter and I have had some of these conversations before offline in the last year's session. I think we do need to have heart, right? I mean, yeah, like the Mumford and Sons songs, heart and head at the same time. We're not a business, right? If we wanted to be a business, we could be, right? Walter, Paul, maybe not me, but they certainly have the skill to run a for-profit business and scale it globally, right? If we wanted to do a business, we could do that, and we are not doing that. So there is a difference. Our organizations have to look and feel different than a business. Now, I say that we get to do that because we have an advantage, right? That we don't have to show any kind of progress in any way in a small period of time, right? We don't have to make quarterly reports. We don't have to report to the SEC. We can take our time. Yes, we don't want to take our time, but we can. We have that option. And that is a substantial difference from for-profit operations, right? Let's double down into that. If it takes us an extra week or month or year to solve a substantial global climate change health problem, do it if you have a real solution, right? And then, of course, you do have to solve these scale issues. Walter and Paul have done that through partnerships. That's a good path. Partnerships hasn't really worked like that for us. We certainly need to show the real-time value to an organization to use our solution, right? Whether it is for improving health outcomes or advance notice of a risk that's about to hit a supply chain. But let's not forget that we're here because at the end of the day, we derive value from saving the world, more so from improving our shareholders' financial positions.
Thank you, AJ, from your perspective, sharing that. And this is why this panel works really well, because we get different perspectives and allowing the audience to decide what's best in their situations and where they're at. Paul, Rodney, how about yourself? Like, based upon that question, what, if you want to elaborate what was either shared or any new insights to the foundation, principles for starting a nonprofit in this segment?
Well, foundationally, it's just like if you had a product that you developed for the market, the most important aspect of that product or service is what value are you offering to the community or the customers. And that can take time to develop. You can iterate that, and maybe you get feedback from the customers and you change the widget and you do something different, and it eventually becomes really, really perfect and very valuable. So at the end of the day, it's the most important thing to establish in business, whether that's non-profit or profit, is what value are you offering the community? What problem are you solving? And how are you doing it in a different way than someone else? How are you innovating? So if you can define that very clearly, then your path to success is pretty much guaranteed if you actually have some value to offer. So in the case of Food Yoga International, there are plenty of big players in this space. As you know, all you guys know the World Food Program and Hunger America. There's so many big players, Save the Children. But what makes us unique is that we're totally plant-based, and it's all freshly prepared meals. So we're not providing packaged meals. It's not repurposed. It's not dry crackers and peanut butter. It's not frozen meals. It's freshly prepared meals that day. The grains and the rice are washed and cooked that morning, and then they're served to the public that same day, which is quite unique when you're operating at the level that we operate at, which is over 1 million meals a day. So that's our value. That's our value offer, is it's freshly cooked, plant-based, and it's prepared with a loving intention. So you have to define that value, that valuable offer. What makes you stand out, and that has to be the foundation of whatever endeavor you want to do.
Wow, that's great. That's gonna actually go into the next question when we get there. We'll definitely want to elaborate there. So thank you for sharing that. Emil, I know you just came in, and if you, in 2 minutes or less, can you address from your perspective and your experience, what are the foundation principles for starting a nonprofit in the healthcare sector?
Okay, yeah. So, I worked basically in software development before, so I didn't really have any experience in the healthcare space. So I learned a lot along the way. so I guess I kind of started like kind of dreaming like, hey, we can just build this app and release it to the world, right, for diagnosing COVID from your smartphone. But what it turns out is like I didn't really consider about the FDA and all of the regulatory hurdles. So I think like one of the best advices for healthcare nonprofit is like pair up with somebody who knows more than you, or even get like those advisors because yeah, you need to really think about like okay, so I want to build this thing, but what is the regulatory pathway to get this to the market, or are we going to do it in a way where the FDA approval is not needed? Um, and and yeah, even as like some others were saying, like nonprofit is actually a business. Like we don't have VCs like kind of on our back saying like, hey, you gotta make more revenue very quickly, but we do need to think about how will we have a sustainable revenue. So like we're gonna apply for research grants. These may take a year to come in. What do we do in the meantime? And okay, so even if we work very hard, we spend 5 to 10 years. Like usually, if we're talking about medical devices, it's usually 5 to 10 years before you get the product to the market. So how are we gonna like fund ourselves until then? And so yeah, I think really like paying attention that the money doesn't come right away, and you still need some sustainable revenue to have some full-time staff to execute and push things forward. Because volunteers are great, but usually they're not at the same skill level as somebody who is like worked in the industry for like 30 years, for example, who's going to give you 20 hours a week to execute if you pay them, so that'd be my advice.
Okay, thank you for sharing. Appreciate it, Emil. That's some great insights from all of you here. So we're going to move on to the next question, starting with Walter. So, how do nonprofit healthcare startups effectively balance mission and management when planning to scale? And if we can keep it to 2 minutes, that would be great. And we'll go down from Walter down.
Terrific question, Christopher. Um, in a for-profit, stakeholder, shareholder success is a key issue. In a nonprofit, the key issue is mission. So to be able to grow and sustain a nonprofit is continuing to look for those elements of the support system that makes the mission grow and serve more people in the community. There's not enough food, there's not enough water. We know that there's not nearly enough healthcare products and services. So that means if you're going to grow your nonprofit, how do you grow your volunteer base? How do you grow your financial base? And if you use in kind, which many food ones do, with certainly Medical Bridges gets the benefit of surplus from the Texas Medical Center, how do you get the in kind and that you can grow it as a fabric? It's a little bit like blowing up a balloon that has different colors on the balloon. You can't blow up 1/3 of the balloon and have the other twos be flat. So the management skill that's required to grow a nonprofit is just as significant, or maybe more so than a for-profit. Because with a nonprofit, typically your philanthropy, you're getting your philanthropy every year. You don't have typically, sometimes you have grants, a 5-year contract or a 7-year contract, or a product that somebody in the industry can't do without. You're basically often rebuilding your base every year. So it takes a lot of management skill to grow the funding, the volunteers, and in-kind donations if you need them in a consistent way so you can advance the mission.
Thank you. Great answer, Walter. Thank you for sharing. And we'll go down to AJ. AJ, would you like to elaborate to what Walter or add anything new or addition to how do nonprofit healthcare startups effectively balance mission and management when planning to scale?
I think Walter did an excellent job with that answer. That's exactly right. It is a big balancing act, and it is a challenge. I think you do kind of have to find the right kind of people. There are business school programs that have separate educational tracks for nonprofit leadership, and those kinds of sources can help you find the right people. But Walter was exactly right that it is a challenge to manage to mission while being effective and making sure everything is done the appropriate way. And that I'd say the reason is when you manage to mission, we think, hey, this is all good. It's all a feel good story. Everybody's going to be on board doing this right. So you kind of it's easy to take your eye off the ball on looking at the actual details of what the organization is attempting to do and doing. That's what I see the most of, that people get so much into mission that they forget managing it to keep the lights on. So that's my biggest challenge and my biggest pitfall that I'd share.
So the planning, you got to, being proactive with the planning, scheduling the goal, just making sure that you're not allowing, certain things while they're important, but maybe not as important as something else. And now you become lopsided
and track that plan. Right. You're right. Make a plan and then track to it. Don't just work on the good stuff.
Absolutely. Paul Rodney, from your point of view, to the question, again, how do nonprofit startups effectively balance mission and management when planning to scale?
It's a tough one, and Walter did a fantastic job of answering it. It's hard to follow up on that one, but you're right. It's the thing is with nonprofit is that often it's going to appeal to a certain type of personality, and usually those people are more sentimental, more heart-centered than logical, more practical. And therefore it becomes a bit of a problem because they have the right intention, they have the right feel, they want to do the right thing, they want to save the world, but they don't have the proper training in terms of like managerial skills that are needed to make the project successful. So it's important to find people that, and it's a hard one, to find people that are heart-centered but also practical, that know how to like execute. And sometimes it can be that you're going to have a variety of people on your staff who are have more managerial skills, more practical, more grounded in the real world. As long as you can emphasize to them what the importance of mission is to them, but the mission itself is like the guideline. As long as they're on board with like the mission being the guideline, the path that we need to go down, but give them the freedom to like execute according to their skill set to make sure that they can be effective in their work, then I think it's fine. If you have a situation where the leader of the organization is not very skilled in terms of like practical management, but they're like very heart-centered, then it's important that you have to balance that with for example, an operating officer or something, a senior management who can help balance that vision-centered personality with down to earth practical skills that can actually can make that vision a reality.
Thank you, Paul. We appreciate that with sharing. And Emil, would you like to close us out with that question and bringing from your perspective? If you would like me to, I can repeat it again. Just again, how do nonprofit healthcare startups what are what effectively balance mission and management when planning to scale? Sorry.
With planning to scale, you said?
Yeah. Yep. So the balance between mission and management when scaling.
Right. Okay. So yeah, I think that as nonprofit founders, we're probably really quite driven on the mission, right? So, but what I found is sometimes a mission is not realistic. So like you're trying to build something and then you realize that the FDA, it'll be like very difficult to get their FDA approval for a certain product. Or, everyone has different types of spaces in healthcare they're working on, but I think you really need to balance the mission with what's realistic as well. And also having people in the team who know how to execute. So for example, one thing is really important is that you have from the leadership kind of giving a mission, which is really driving the volunteers and they feel very motivated and part of a cause. But at the same time, kind of having some people are mentioning like the business expert who knows how to kind of focus organization in places where for example, how do we write the grant to get the research funding? Or what problem should we focus on? Maybe tuberculosis is a bigger issue than COVID right now, for example, right? And then also thinking about which geographies do we focus on? So kind of there's like a lot of like almost like infinite different strategic choices that can be made. So and then a lot of the pathways kind of lead to nowhere as well. So like for example, you could have a really strong mission and you're trying something for 2 years and it was never going to go anywhere. Or if you have that strong management who has, for example, been in the industry for 40 years, for example, can just tell you, hey, like this route is going to work. Why doesn't everyone focus their mission there? And even pivoting. So like for example, one of my Harvard mentors, he says that, hey, he sold 7 startups, mostly in the life sciences space. He built startups, right? He says that on average, startup needs to pivot 50 times before getting revenue. So I think the same is for nonprofits. Like when you're starting from scratch, like it takes time to really find like what is the product market fit, like what are the real needs, where can you make impact, and how will you have the sustainable funding revenue to have full-time staff to push that forward. And it can take some time. Like you pivot, you keep moving towards like what. So basically, that would be my feedback.
Okay, great. Awesome. Great perspectives from all of you. Now we're going to go into the final question of for the summit today. So again, if we can keep it to 2 minutes, we're each going to have 2 minutes to this question, and then we're going to wrap up with that. And then one thing we're going to ask from Walter at the end, Walter, we want to get a testimonial from you, a 1 minute testimonial after the panel discussion's over. You'll go on screen by yourself and do the testimonial, and then we'll close it out. So the last question, starting with Walter. What are common financial challenges for nonprofit healthcare startups, and how can these be overcome?
All nonprofits have financial challenges, not just healthcare nonprofits. During an election year, often those challenges are more difficult because people that are passionate about candidates will be spending money to support their candidates. Uh, Donors, your best donors will have donor fatigue and leave. So your funding is lumpy. And so, being from a business ready to deal with your costs when the funding is lumpy is really important. That's the biggest challenge, is maintaining long-term sustainable funding. And all of us that have talked today are in areas where the needs are so great, we need to grow. So to make sure that the funding grows along with the growth of the mission and the service is vitally important to the long-term survival of the organization.
Wow, thank you for sharing. Thank you for sharing. And AJ, would you like to elaborate further on that or add from your perspective?
It's very interesting. I hadn't considered or experienced, as Walter says, that the election year crowds out funding for nonprofits. It makes complete sense, and I'm sure it happens to an extent. I always see the election year as a time that we are also advocating and educating current and future candidates who, obviously those who we think will win, on the need for funding for the types of things that we do, which is itself a year-long or multi-year-long activity. I would say that because of the lumpiness of funding, because of the fact that we are dependent, one of the biggest challenges is that it's a little bit harder for us to get that line of credit, right? So often you have nonprofit leaders taking personal lines of credit to sustain the organization because to securing it at least with some sort of personal assets. That's a challenge, and that honestly, one of the only ways that I've seen to address that challenge is to run operations at a lower rate than we could otherwise, just because we want to protect and preserve the ability of the organization to continue to thrive. We are seeing a growth in angel and venture capital investments into the nonprofit space. So that's something that I think we all have to dip our feet into a bit and see exactly what are they looking for from a nonprofit who is not going to guarantee any kind of particular return, but will be able to say that our effects will have a lasting impact on social good. That's something that I really am curious and interested in exploring further.
Wow, great. I love to hear it. And we'll at the end we'll just when we finalize this question, we'll just get input from everybody quickly before we adjourn this summit. Paul Rowdy, how about your perspective on the question on the financial challenges? Oh, we can't hear you.
He may be frozen.
Yeah, you might be.
I can
frozen.
go in the meantime,
Oh.
if you like.
Yep, yeah, he came off.
Speak
All right,
on
go ahead, Emil, and then we'll bring Paul back.
Yeah, so the question about the financial challenges. So yeah, we've explored like a lot. There's a lot of different ways to actually fundraise for the nonprofit. So one is like private donors, where you just go to like very wealthy people and say, hey, like, do you want to write a $10,000 check to support us? We'll give you a tax deduction, right? Other is like applying for research funding grants. So like those can come from like places like NIH, for example, U.S. government, or there's also foundations like I know, for example, Gates Foundation. And other is I know some founders sometimes they put their own money. The board of directors puts their financial money into running the organization. The other aspect is like crowdfunding, where like for example, you have like a GoFundMe, where like I know a lot of people can put like $5 each, right? So I've actually tried all of these. So the thing about putting like your own money in it is not sustainable. So one good thing about nonprofits is that they don't really die. I mean, if you're not reliant on full-time staff and it's all volunteer run, it can basically continue forever, like unlike a for-profit, right? But but basically, in our case, the problem with the fundraising from wealthy donors is like if you don't have a very strong connection already, it's basically going to take a lot of time because you're just going to be running to like 1,000 pony shows every day. You reach out to 1,000 people, it funnels down to maybe 100 or less, or maybe 10 responses. You have the conversations, you might get one donor maybe. So it's like a very time intensive, and you're not going to be able to run the organization at the same time that you're trying to fundraise that way. Because really fundraising from private donors needs to come from the executive level. You can't really delegate that work. So like we were looking at like grants because partnering with universities, with professors who want to be PIs, advance their research, basically creating these win-win situations where people like really want to put time and write down the grants. You can have volunteers write grants as well. That's a totally delegatable job. Crowdfunding we tried as well, but that's has proven difficult. I mean, it depends on if you're actually giving value to the people. For example, let's say we're um, I don't know if you're going to give value to people directly, then they will be more willing to donate. But it also depends on the cause, where people feel empathy for the cause as well. So that's kind of my take on that situation.
Thank you, Emil. Appreciate it. And Paul, I know you're back. If you'd like to close us out with the with this question about the financial challenges, what are the common financial challenges for nonprofit healthcare startups, and how can these be overcome from your experience?
Well, as Walter pointed out, it's been tough for all nonprofits, particularly this year for us. Sanctuaries, food reliefs, you name it. It's people are struggling with inflation and so on. So the most important thing is not to just depend. First of all, not depending on your donors as the only source of funding. If you're going to do some fundraising drives, emphasis should be on monthly giving, so you have a residual income. But the most important thing is to diversify your sources of income. Look for all different ways to bring in money, whether it's grants, whether it's corporate sponsorship, selling merchandise, whether it's social entrepreneurship. For example, we actually started a crypto project, a blockchain project. We we're one of the co-founders of a project called Kindly, and Kindly has built a social impact tracking engine on the blockchain, where we actually track the impact from dollars or crypto to actual real world impact in the real world with photographic evidence. So we're one of the founding organizations behind that project, and that's going to be another source of income for our charity. So looking for different ways to bring in money, innovating, being entrepreneurial, not just leaning on the individual donor, because that's very unreliable, to be honest with you. Life changes, things happen. So if you're just depending on donations from mum and pops, you're never going to succeed. You got to expand and diversify your sources of income.
Yeah, and it's not easy. It's a process, but like you said, you have to be proactive and always, again, looking for new ideas. Just like what Emil talked about, crowdfunding didn't work, and a lot of times crowdfunding doesn't work for certain things. It really depends on what it is. So, well, gentlemen, this has been all great, wisdom and knowledge and that you've shared. We hope that the audience, has taken this in, that they can start applying to their situations and where they're at. I want to thank you all personally for being here today and being part of, not only individually contributing in your area of expertise, but also on this panel. And everybody from Glorium Technologies again extends a gratitude and thanking you for being here with us today.
Thank you.
Thank you. And Walter, if you could stick around for like just a minute, they're going to put you on camera to do your testimonial.
Perfect.
All right. And here we go. I'll let them, once it takes me off. Oh, not me. You want to?
Glorium Technologies has a heart alongside its head. Glorium Technologies is an organization that's successful in its business and worthy of your consideration for many technology issues. But equally as important is they have a heart, the kind of heart every year to put on a virtual summit on nonprofit healthcare startups. The world is troubled. The world is on fire. The developing world is suffering. And if there is ever a time when people are needed to stand up for humanity, this is that time. And Glorium Technologies taking a leadership role in promoting humanitarian service. Thank you, Glorium Technologies.
Okay. Thank you so much, Walter. Appreciate you. Thank you, everybody. We want to thank everybody that took the time out of their schedule this morning or afternoon, depending upon where you are, to be with us here for the Nonprofit Healthcare Startup Summit. We are grateful for you, being here. We hope you received a lot of value and wisdom. And if you have any questions, feel free to reach out to Glorium Technologies, and we'll make sure to put you in touch with any of the experts that were here today with any last minute questions. Well, thank you, everybody. We want to wish you a great rest of your day, and we'll see you at the next summit. Take care.